any one of you, feel free.
Great.
A few more people sign in or log on. I'm going to explain what's going to happen tonight, so you know every Sunday when we meet what goes on. I know it's Super Bowl Sunday, so what I did, I put it to record, and maybe on a break I'll go over there and see what's going on. Then I'll come back and then I'll watch it again. But you know, that's what they did.
Yeah.
Everyone, you know, unless you have the TV right next to you and you can look at it at the same time going back and forth, feel free. It doesn't bother me none. As long as you review and understand the material, that's my main job here. You'll see it. You should see on the screen saying the human body, chapter 6. So to my knowledge, all of you probably went through chapter 6 already with your instructors. Yes?
We went
Can I
through the
say
first
that?
half.
Because it's
Part 1, yes.
and you went over, say it again, Isaiah?
Part 1. So I guess the
We got up to
skeleton, the heart.
The nervous system. We were getting up to that on Tuesday. We're going to do that in the morning.
Yeah, we just got to nervous system.
Okay, we're going to be reviewing a lot of things here within these 3 hours, okay? And then what I'm going to focus on, I'm going to say, okay, make sure you know cardiac, make sure you know respiratory, make sure you know the nervous system and things before that, because what my job is preparing you guys for your first exam, okay? So to my knowledge, mostly what they give on your first exam, the administrative stuff you did, maybe some vital signs, if you did the vital signs already, and also the human body. Now, the human body is a long chapter. So we'll touch base on a lot of stuff and we'll finish this probably today. And then I'll go over my notes and say, okay, we covered this. Do you all understand this? Why? Because you're going to see this on your exam more or less. Okay. So that's what my job is. Make sure I do a nice review with you and you're prepared. Okay. So I definitely record this. And like I said to Kenneth earlier, we're going to try to set up a WhatsApp. And the reason why I set up that WhatsApp is because everything I have in tutoring for BMCC, Lehman College, John Jay, Yeshiva University, LaGuardia, we're on a WhatsApp. And what I do, I transfer the good information I have to help you all to that. So I'll send out some handouts from LaGuardia, from medical legal, and all this other stuff that you can say, oh, this is nice information. Okay. And you want to look at that. And then at the end of the course, towards when you're going to do your state written, I send you an 80-page, 118-page, and then I forget the other one, how many pages, handouts like your whole book condensed. Okay, so you definitely want that for the, okay, so make sure you all understand and know it. What I'm going to do before we lose track, I'm going to start recording this. I think we got Alejandra, if I'm saying the name correct, and Kelly. Kelly, that's the easy name. The last name is Canelas. Did I say that right?
Canales.
Okay, I want to make sure. My Spanish is terrible.
Yes.
So you know that. Okay.
That's okay.
So let me record this because I will transfer this to your WhatsApp when we create it.
Okay.
Once it uplinks or downloads. I don't know what the words you guys really use for this. And then I'll send it to you and you'll have this whole thing to review.
All right.
Make sure we do this. Hold on. In about another 2 minutes, I'm going to send out the attendance sheet via the computer. It's going to say poll sign in.
Okay.
Okay, record to cloud. There you go.
Recording in progress.
It's recorded to the cloud as we speak. All right, good evening, everyone. My name is Frank Nuki, one of the CICs from LaGuardia Community College. Today, we will be viewing the human body, some vital signs, and probably lifting and moving and so forth. Did they state that also going to be on your first exam?
I believe they did.
Okay, because to my knowledge, what my notes state was lifting and moving, possibly vital signs. I definitely know for sure you're going to get respiratory, probably. cardiac, and probably the nervous system. Okay, we're going to go over this whole chapter.
And lifespan too.
And lifespan. Okay, if I'll double check my notes and I'll tell you more or less what they put on lifespan development. Okay, otherwise than that, it's just a guide. You can always go back to the video here, look at it, and this will help you for the future exams also, especially when you get to your midterm and your final. A lot of students go back to all the videos that they get from the WhatsApp, okay? And then they go over their notes and so forth. The most important thing you guys have to understand, your senior instructors are, I think, Kenneth told me it was Irene and Yadiro for the morning class on Tuesdays and Thursdays, if I'm correct.
Correct.
All right. Thank you so much. Now, I'm a senior instructor also, but I'm only here to do review and tutoring. You have to go by what they say. If something conflicts what I'm saying, correct me, please. Okay? Because remember, I'm going old school. I'm going way back 30-something years, okay? I've been doing this over 30 years. I'm going with Laguardia, my 28th year. I've been there since 1995 as an instructor. So anything change? Say, Nuki, no, according to your Daryl or Irene, this is the new protocol. This is what's going on. Okay? I just want to make sure we clarify that. So let me send out the poll for all of you right now, because this helps me. And what happened here for some reason? It didn't do it. Oh, create. Oh, boy. Polls and meeting reports. There you go. Just give me 1 minute.
Let's do this then.
Okay, I just sent it out right now. Make sure you click onto that present, because it keeps it on the Zoom link for me. And then I can easily go and say, okay, these are the students who attended and so forth.
Okay, I just submitted.
Thank you so much. I appreciate it.
No problem.
All right, I'm going to leave it up for a little bit, so in case any other students come in, they could sign in.
Okay.
Right. Okay, Kenneth got intro, human body, vital signs, lifting, moving, administration requirements according to Schoology. We're going to be on quiz 1. No problem. Thank you, Kenneth. Appreciate it. Now, do you all see my name, my email, and my cell number on the chat?
I only see your name and it pronounces you as host. It doesn't give me any other information.
Okay, let me do that now. And let me do this, copy, paste. How about now?
I can see it now.
Beautiful. Write that down, please.
Okay.
That you definitely want to know.
Mm-hmm.
In case you need to get in contact with me, you let me know who you are. Okay, what class you're from. You could email me. You could text me. Or once we create this WhatsApp, I definitely one of us who knows, who's savvy to do with computers to create this. It'll be us only. Okay?
Okay.
Whatever information I send you is for us. And of course, your fellow students who want to join, that's up to them. Because right now I see about 1, 2, 3, 4, 5, 6 of you besides myself. And you would get the Zoom link first. Then once the others join them, they will see everything we reviewed today, okay, or this evening. So please make sure you know that. So which one of you are computer savvy, please make yourself the administrator, put my number there, and then I'll transfer all the good information I have to you. I'm talking videos, skill sheets, handouts, medical, legal. You'll see a lot of good information I have that you definitely want. All right? So let's begin here with the human body. Now, you're going to notice I'm not going to stay on the whole thing here. I'm going to jump a little bit on this PowerPoint presentation. The reason why, I'm going to say, okay, this is in your book in orange on your chapter 6 on JB. Make sure you highlight this. Know this. You always see these on exams. It could be class or it could be the state. So you want to make sure you really highlight that and know what that means, okay?
Okay.
It always begins with National EMS Educational Standards Competencies. It talks about, the fundamentals of EMS system. It talks about the emergency medical, EMT, medical legal, ethical issues, and so forth. Nice to know, okay? Don't worry about this. Here is what you need to know. If they ask you what's an A&P question, you need to know the word A&P, okay? Anatomy, the field of study that focus on the physical structure of the body, and then it has the physiology, gives you a step further examining the norms, functioning activities, okay? And then the word pathophysiology. So highlight that in your textbook. That's always under introduction. It's in orange. Don't go crazy. Just know it, make your little flashcards, whatever you do, because that's going to help you for the future. This you must know. They always ask you, what is the anatomical position? Okay? The anatomical position, I'm going to stand up, and this is what you need to know. When you stand up and your palms are facing forward with the thumbs lateral to the side, and you're standing like this, I don't know if you can still see me.
Yeah.
Okay? That is your anatomical position. You always need to know that. So your patient's side, if your right hand, that's the patient's left side. Your left hand or left side is the patient's right. You always need to know that in front of you, just like that, is the anatomical position. Make sure you know that. That's under that typographic anatomy, which I don't know what page is in your book, because you need to know that, but I could find it for you. Oh, here it goes. Page 190. So if you follow in your book and you want to make it easier for you, that's fine. Okay, then you're under topographical anatomy, and you're going to see words like the umbilicus, topographical anatomy. Know those words just in case, that anatomical position. These always test questions. You got to know these. Okay, it's in your book on that same page, 190 and 191. Highlight that in orange. Coronal, also known as frontal, sagittal, lateral, mid-sagittal, midline, and transverse. You must know these. They always give you test questions on this because how they would give you, let's say, mid-sagittal. Mid-sagittal always goes down the midline and breaks you down in both equal halves. You need to know that. Okay, equal halves. If I give you the word sagittal, you still have a left and right side, or the patient still has a left and right side, but it's not equal. It's like a portion. So you need to know that just in case. So separate mid-sagittal from sagittal. That coronal or frontal, when you break that to the sides, it's in your book on page 190, you're going to notice you have an anterior, which is the front, and a posterior, which is the back. You need to know those terms. You have to get used to writing down and talking or speaking to other healthcare professionals in medical terminology sense, in EMS jargon, not the English version, like front and back. You need to say anterior, posterior. If you're saying to the side, right or left side, you're talking lateral, right lateral, left lateral, depending how they're laying down. Okay, so you need to know these words. This Midline means straight down the middle. You'll see words like medial means going towards the middle, okay, or medium. Know that when you see it. Now, you notice that word transverse? I want you to think, you ever seen like magicians trying to cut a person in half, and you have the superior portion and the inferior portion, like the top and bottom?
Yes.
Upper and below? You need to know transverse plane. So when you see these, but all the planes they have in the body, just know the words: frontal or coronal plane, sagittal plane, mid-sagittal plane, transverse plane, okay? So know how this is broken down into different words when you're looking at the patient. I want you to always utilize this. It's easier. If you're using the word superior and inferior, superior means above, inferior means below. I want you to use the trunk. It's the easiest way, okay? So you will use like from the neck portion here to your waist, okay? For superior and inferior. For your extremities, the upper arms, the arms itself, upper extremities and the lower extremities, I want you to use distal and proximal. Easiest way to answer those test questions they give you in class, okay? What is this distal to that, or this proximal? And once you know these words, they always give the test questions, class and state, to do with the extremities. It's rare that I see them using superior and inferior for distal and proximal to do with the extremities. They normally would give something like this. The heart is what to the diaphragm? Superior, inferior, distal, or proximal? What is it?
Superior?
Superior. The heart is superior to the diaphragm. It's above it, see? So once you utilize the trunk, it's easier to answer that test question. Give you another one. Let's use distal and proximal. You take my forearm here, have a little cut here, mosquito bite. Should never picked on it, right? But you see it here, okay? So here, I would say, and watch this, my wrist is what to my elbow? Distal, proximal, superior, inferior.
Distal?
Distal, away from, right? So my wrist is away from, distally from my elbow. If I was to say this, my shoulder is what to my elbow? My shoulder is what to my elbow? Distal or proximal?
Proximal.
Distal.
Proximal.
Mm.
Up here. This elbow would be distally. So that would be the answer. You see how you separate it? So you
Right.
have to know the terms distal, proximal, superior, inferior, lateral positions like left lateral recumbent, also known as the recovery position. Things like that. Things in medical terminology. I think they use the words like semi-fowler, fowler, supine, prone. You need to know these terms. You see these a lot on exams, how you find a patient, or when you're going to write your PCR, ACR, which is chapter 4, okay, which is documentation and communication, or communication and documentation. To know this, just in case they ask you, and this is how it looks. Just directly from your book. Okay? So when you see this, know this. It's on page 190. 191 you go to, you can highlight and look at the from cells to systems and highlight that. That's okay. I want you to go to the skeletal system. This is where you're going to see test questions at coming up. 206 bones. You better know this. They love to give that. 206 bones. Okay. Yes, in the beginning, there's really more than that. But when other bones fuse together, technically you have 206 bones. You need to know you have 206 bones. When they get more into test questions on the bones, they're going to break them down into axo and appendicular, okay, which is these two right here, the pelvis and so forth. And then they get further. Skull, facial bones, thoracic cage, vertebrates. I'm going to give you ways to know this and understand this when you see it. So when they ask you test questions, you can never forget it. What I need all of you to do, and I know you got your senior instructors, but if you want to know every bone in your body, okay, I need you to inspect and palpate your body. Take a nice shower, come out to shower, put on your underwears, and stand in front of that mirror and start inspecting and palpating your body and naming every part. That's how you'll never forget it. So if I was to start with my head, okay, I'm going to take my glasses. I really can't see when I take off my glasses, but I'll try. I'm still in front of you that I can see. Ready? Frontal lobe, parietal, occipital, which is the back portion, temporal, orbits of my eyes. You know, that's the globe also. Nasal cavity, maxilla, mandible. Are you following me? So when you get used to naming these body parts, these bones, there's no way you could get a test question wrong because you know what they're talking about. If I say the word forearm, can you give me the two bones that are in your forearm? Forearm is a regular English word we use. Medical terminology, what two bones are there?
Radius and ulna.
Radius ulna, right? And then you know this by heart, okay? So you can easily say it out to me. There's only us, or write it in the chat, whatever you want to do, okay? Remember, my job is to make sure you understand this material. Please, and this is me, when you read that textbook or anything from protocol, handouts, whatever you get from your instructors, read to understand, not to memorize. Anybody can memorize anything, okay? If you read and understand, you'll be okay. Memorization would follow. That's Nuki's way of teaching. I'm different from Yaduro, Irene, and all these other instructors, but I've been doing this a long time, so I know what I'm talking about, okay? Do you guys meet at 329 in the room?
We do. C3.
Okay. You ever seen those plaques in the back?
I think so, yeah.
Okay, look, the next time when you go there, I say and the rest, I want you to turn around, look at that, and then you're going to see this small Puerto Rican with a slight little hair. That's me, okay? That's students giving that to me throughout the years of me teaching because they wanted to. I don't ask for nothing. What I want to do is make sure we make good EMTs and paramedics from Laguardia. I know what I'm talking about. I'm here for you guys, okay? But I only see you doing review and tutoring on Sundays and a night class on Fridays. Okay?
Yeah.
So you have any questions, please, you know what to do. So let's continue here. So you know the exoskeletal, what it consists of, highlight that in your book. The joints, ball and socket, always test questions right here, and the hinge joint. You need to know what to ball and socket. So I want you to think of your shoulder and your hips, okay? That's the common one that always comes out, the shoulder and the hips. A hinge joint, I want you to think of your knee and your finger, like this. You notice your finger goes up and down like that, like a hinge on a door? If you turn it sideways, right?
Yeah.
That's what they call to do with hinge joint or ball and socket. Make sure you know that because those are always test questions. They may ask you other things that you may see. They may ask you what are tendons, okay, and what are ligaments. You need to know that ligaments, and this is how you remember it, BBL, bone to bone held by ligaments, BBL, okay? When something's wrong with that, with the BBL, with the ligament, it is called a sprain, not a strain. A strain is this, BMT, like the subway line, bone to muscle tendon. That's a strain, okay? Could tear it and so forth, pull it. So separate those two, tendons and ligaments. They'll give you cartilage and so forth. This is cartilage right here. See your ears, your nose, that's all cartilage, okay? I want you to know these terms and these words. So in the book, make sure you highlight that when you see it.
Can you give me that again? You said bone to muscle, that's a strain, and the other one was?
Bone to muscle is a tendon, BMT, bone, muscle, tendon, equals strain. Like the subway train, but they'll put the S in front of it, and you got strain. Okay, BBL, bone to bone, ligament, sprain with the P. You got that, Isaiah? Beautiful.
BBL was what again? I'm sorry.
BBL is bone to bone ligament. Sprain with the SP, sprain.
Sprain. Okay.
Okay. This is what I stated before for you. This is just a diagram of it. This you need to know. I never have yet, and it's different instructors, so they may do this. They may ask you how many bones, but I have really never seen it on exams, especially in the state. I see that you need to know every bone. You noticed before when Nuki was doing, and please call me Nuki. Don't call me Frank. No one calls me Frankie. Okay? Everybody calls me by my last name, Nuki. Okay?
Okay.
How I inspect and palpate all the parts of my body, especially my head. I went frontal lobe, parietal, occipital, temporal. That's what you need to know here. When you look at this diagram, that's how I want you to remember it. So when you describe it, you know it. Now, here's always a test question too. See this opening, this hole? That's in the base of the skull. That's called your foramen magnum. You need to know that. They always love to give test questions on that. Okay? So the test question with me, this is located at the base of the skull. Oh, okay. That's where the spinal cord that goes down. Oh, I know what that is. That's the foramen magnum. It could use the word opening or hole, base of the skull. This one right here, foramen magnum. Got it?
Yeah.
Short, sweet, easy. Now, you're going to think Nuki's crazy, which I am. Just letting you know, okay? Breakfast, lunch, and dinner. You're saying, what the hell is Nuki talking about? Ready?
I heard that.
You
Yeah,
know
we heard this
33
one.
vertebrates. Say it again, Devin.
We heard this one from one of our instructors.
There you go. Breakfast, lunch, and dinner.
It was very fast though. He went through it so fast that it was hard for me to catch on to each and every letter, like breakfast, lunch, and dinner.
Oh, watch. This is easy. That must have been Yadiro. Had to be Yadiro, okay? Had to, okay? Because Yadiro, if I remember correctly, did everything at Laguardia. And he's an awesome instructor. I love that guy. Awesome medic, too. Okay? Just tell him you do review with Nuki. See what he says. He's a great person. And Irene also. Now, here, watch this. 7 o'clock in the morning, you get up. You got 7 cervical. 12 o'clock in the afternoon, you got 12 thoracic. At 5:54, a few minutes before 6, you have the lumbar, sacrum, and coccyx. You got that? Breakfast, lunch, dinner. Now, here goes the test questions. You must know that in order. Cervical, thoracic, lumbar, sacrum, coccyx. You must know this also. In the cervical, how many you have there? 7. But what keeps you alive? 3, 4, and 5. 3, 4, and 5 cervical keeps you alive. Got that? So cervical here, where my mouse is going over, if cervical 3, 4, and 5 is damaged, if you ever heard about Christopher Reeve, Superman, that many, many years ago, he fell off a horse, he injured 3, 4, and 5, he wound up becoming paralyzed and so forth, because he was on that machine and he was breathing, it looks like a little straw, and he was maneuvering his whole, I think, wheelchair and everything electronically through there, okay? So you must know that 3, 4, and 5 keeps you alive. More questions. Which one from C1 to C7 is the most palpable? That means you can actually feel C7.
7, I believe.
That's right, C7, thank you. Now, you need to know this. You have 5 sections: cervical, thoracic, lumbar, sacrum, and coccyx or coccygeal. You need to know from here which 2 are most susceptible to injury, always getting injured. The cervical, which is the neck, and the lumbar. State and class test questions. You must know that. Please make sure you understand that, okay? Now, more questions we give you out of here. We're going to ask you, see these 2, the sacrum and the coccygeal?
Yeah.
They use words like, of the sacrum and coccygeal, which sections are fused or sutured together? The sacrum, which has 5, and the coccygeal, which has 4, technically vertebrae. Okay, they are fused together. You need to know that. And if you look at it here, look all the way down here, and those are fused together, aka coccyx, coccygeal, or tailbone, right here. Sorry about that. And then the sacrum. Those are fused together. And they may ask you the number. Which one is 5? Which one is 4? So you need to know that. Any questions so far? Oh, beautiful. Okay. So 7, 12, 5, 54. Thoracic here is 12 vertebrates. Make sure you know that. It's when we get to the front part to do with the thoracic that we're going to ask you test questions, and you need to know this. And I'm going to bring it up now. So we know it's 33 vertebrates. We know the all 5 sections. Make sure you understand that. Remember, you're going to have the video to come back to reference to it. Okay, you need to know that there's 12 vertebrates right here. And they have the 12 ribs. Okay, 12 pairs of ribs. You need to know the sternum. What is it called? The sternum, you know it as the breastbone also. You need to know is the manubrium, the body, and the xiphoid process. So a test question will come out, what is the lowest portion that is inferior in the sternum? And you're going to say, okay, sternum has 3 parts. I have the manubrium, I have the body. Oh, I know what it is, inferior, the xiphoid process. So you need to know that. Make sure you understand these things right here. Now, you notice here when you have vertebrates, there's a lot of things in this whole thoracic cavity, okay? You need to know, because when we get to respiratory, between both lungs, there's this word that they give out called mediastinum. Mediastinum. They're going to ask you, the area between both lungs is the mediastinum. What organs are in there? That's very important. Write this down. The heart, the great blood vessels, the trachea, the esophagus, and the thymus. You must know that for the area between both lungs, called the mediastinum. I'm not asking you what you see here in front. I'm not saying the thoracic cavity contains the heart, the lungs, esophagus, and the great vessels, and everything else I just mentioned. I'm not asking you that. I'm asking you right now, what is the area between both lungs? Now you know those 5 organs. Okay, you have to know that. It's always test questions on that. You could easily name everything else that's in the whole thoracic cavity. But I want you to know that mediastinum, because when we get to respiratory,
can you repeat those again? The lungs.
Between both lungs, the word and the organs, Isaiah. Okay, between both lungs, that area that's between both lungs is called the mediastinum. Mediastinum. Okay. Now, here goes the organs between both lungs. The heart itself, the great blood vessels, the trachea, the esophagus, the thymus, Thymus. Okay? Make sure you know that and understand that, please. When we get into... Go ahead, Kelly, I'm sorry. Go ahead.
You said THYUS?
THYMUS, thymus. I'm sorry, Kelly, and the rest of you. I'm not the greatest speller in the world. Okay. Maybe my Spanish version of me. I don't know. Be nice, my love. My wife's behind me doing her thing on her computer. I'm doing my thing teaching. So we keep each other company. But she laughed because that's the so-called Spanish in me. Okay. Kenneth, thank you very much for typing it. See, there's always a few students who could type fast, and I'm a one-finger guy, Kenneth. Look, this is me typing. Okay?
So that's
thank you.
Media stadium.
He's laughing.
I use my fingers and toes.
There you go. Awesome. Okay. Here, you know, it's not hard. When you look in your book, you're going to see 191, more talking about the bones, the joints, 192, 193. You're going to see, we spoke about the foramen magnum, the mandible, the cheekbones. Everything's right here on those pages, 192, 193. And then you get into 193 in the bottom. You got the breakfast, lunch, and dinner, the whole spinal column, the 33 vertebrae. 194, you got the face, a nice diagram. 195, you got the pectoral girdle. You have also the humerus and the clavicle. I want you to highlight that. Now, the test questions they give you on this one is the names. You need to know the pectoral girdle, also known as the shoulder girdle, contain three major parts. And these are the parts you need to know. The clavicle, which is your collarbone, okay? The humerus and the scapula. They will give you a test question on that. So technically, that pectoral girdle on page 195, AKA shoulder girdle, has those three. You must know that just in case they ask you.
Clavicle, what was it? Clavicle?
Clavicle, humerus, which is the upper arm bone, and the scapula from the back, scapula. You will see that on page 195, Kelly. Look to the right side. You'll see the word clavicle, humerus, and then in the bottom, you see the word scapula. Do you see that?
I actually don't have the book in hand, so I'm going by your slideshow.
That's terrible. You should have the book in hand. Why
No,
you do not have the book?
I have not got the chance to purchase it, sadly, but I will purchase it this week.
Okay, what I'm going to do, if I could do this,
Mhm.
okay? So you could read ahead of time, okay?
Mhm.
I have a PDF version of it,
Okay.
okay? Remind me to send it to you somehow, even if you have to email me.
I will email you after the tutoring.
Right, and here, make sure, Kenneth or somebody, you better create that WhatsApp for me, please. Thank you. Kenneth got his thumbs up, so that's a good sign. Then we could put everybody there after they send us the information, but I'll try my best to send you everything I have.
All right.
All of you.
Thank you.
Okay. You're very welcome. Okay, so that's 195. So they'll talk about joints, upper extremities, pelvis, lower extremity. Highlight that in your book. It's not hard. Upper extremities, what it consists of, your arms, your forearms, your hands, your phalanges, which is your fingers. You need to know all these bones and these names. What are these? Fingers, AKA phalanges, right? What is the part between here? That's your metacarpals. Your wrist, what is it? Carpal, the wrist. You need to know these terms. Remember, inspect and palpate. Here goes the shoulder girdle, AKA pectoral girdle. You know what it is. Clavicle, humerus, scapula. You have to know that, okay? It's right here, everything, what you need to know that. Those major three bones. Any questions so far?
Oh,
No? Okay. The humerus there, form, the radius, ulna, we already went over that. Now here goes all your phalanges. Now, if you notice, the phalanges are all these fingers here, going from here across. That's including your thumb, right? Then the metacarpals, right, is from here, are all these. Here to here. That's this and here. So that's everything right here, if you notice. Then when you got your carpal, that is your wrist. So you need to know these names. Can your toes be called phalanges also? Yes. The toes, when you go further up, what do you call those? Metatarsals.
metal.
What is another name for your ankle? Tarsal. You need to know these terms. That's why Nuki says, inspect and palpate your body. Okay? Any questions on this phalanges here?
They're a little confusing. The terms are very similar with the ankle and the wrist part.
Okay, this is how I want you to remember it. You'll never forget this, any one of you. When you're driving in your car, if you have a car or a family, think of your car, think of the wrist, driving, car, carpal.
Apple. Okay.
Carpal, car. Like carpal tunnel syndrome.
Gotcha.
Got that? to do with the wrist, carpal tunnel syndrome, CAR. You know the tar in the street, the tar, aka asphalt, right?
Yeah.
Your feet touches that asphalt, aka tar. That's really tar. We call it asphalt. Ankle, tar. Oh, tarsal. You got it?
Got it.
Now you'll never forget it. So car, carpals, tar, tarsal, ankle. When you get past the phalanges and going down, or even the toes, you got to go past it this way. So you got to say, if it's your fingers, okay, these are all my phalanges. These are my metal carpals. This is my carpal, right? Which is my wrist. If it's my foot or my feet, it's still my phalanges. Then it's metal tarsals. Then it's tarsal. That's the easiest way to remember it and understand it.
Okay.
You have to repeat it. It's repetition, but you have to make sure you understand the separation of two. Here goes your pelvic girdle. They always ask this. Know the pelvic girdle, what it consists of. Okay. This pelvic bone, always a class question. They're going to ask you, the pelvic bone are fused on what? What is the fused together with? Ischium, ilium, and pubis. Ilium, ischium, pubis. You need to know these three. I always see this on exams. Okay? Make sure you know this. So pelvic bone is formed by fusion of what? Ischium, ilium, pubis. And you're going to see this in your book on page 196. Highlight the pelvis. Highlight the lower extremities. Highlight the ankle and foot on page 197. Kelly, since you don't got the book, I'm saying these pages. So when you get the book, you could go back to this and look at the video and know what to highlight and where to look at it. Okay?
I appreciate
I mentioned this. You're welcome. Okay? So make sure you know this. And that's how it looks. Okay? So look at the ilium, the ischium, the pubis.
Got it.
That's the one that forms it. Okay? So you need to know those three names. Now you notice here, look at here, you can see it better. Look at your coccygeal or your tailbone.
Right.
Okay? Or your coccyx. Look how it's fused together. Now look at the sacrum. You see how these are fused together?
Yeah.
There's no movement in there. They are just fused together. So you need to know that when they ask you a class or state question on that, what it is. Let's go to the next one. The femur, the longest bone in the body, one of the strongest bones, that's femur. Okay, that's one between the knee, which is called your patella, the kneecap, and up here towards your hip area, your pelvic. Okay, so you need to know that. And if you want to look at that better, you can look at the hip and the femur on page 196, top right-hand corner. So please make sure you highlight that and know that. 197 got your ankle and foot, the skeletal system, and then you'll see other stuff there. I'm going to go over the other ones right now. Kneecap, known as your patella. Highlight that in the book. Lower legs, tib, known as tibia, and fib, known as fibula. That's the lateral, the sides of it. So the easiest way to go is tib, fib. So you touch the inner portion, medial portion of your legs, and you go tib, fib, tib, fib. So you know what's the inner port, medial, medium, and the lateral side of it, which would be the fibula. So that's the easiest way to remember it, okay? You know that tibia as your shin bone because you probably hit it many times and go, oh, that really hurts. So, right? Because I know I have, and they wind up with a black and blue. According to New York State, do you know that if you have a dislocated kneecap, according to New York State, you are allowed to put it back in place?
I have a dislocated left knee.
Okay, so does your dislocated left knee, sometimes you have to move that patella, that kneecap back?
It usually does it by itself.
Okay, good. Some people say it does. You're right. So that's a good thing. But according to protocol, when you get to bones and protocol to do with fractures or dislocations, you'll see that the kneecap lateral, you're allowed to put it back in place.
Yeah.
It's good to know just in case for the future for state test questions.
Okay.
Ankles, they also say it's a hinge joint. That's known as what? Your ankle. That is your what? That is your torso. Okay? Ankle is your torso, also known as a hinge joint. Okay? So we went over hinge joint as your knee, your finger, and now the ankle. They're stating that also. That could go up and down a certain way. But you ever notice how sometimes you could rotate your whole ankle almost?
Yeah.
Yeah, right? You ever notice that?
Yeah,
So-
and I hear like a crack.
That's right. When you like doing that. So
Yeah.
that's a possibility. But for state test questions in class, go by what your instructors have taught you and what Nuki has taught you also, okay?
Okay.
This you must know right here. There goes your phalanges, your toes. There goes the metatarsals. And then your heel bone, aka calcaneus. So remember, please always inspect and palpate your body. That's the way you're going to know every bone, what's what. You have to. It's very important. I don't go by the numbers. You can highlight it in your book. All right. But I cannot tell you if they're going to give you numbers. I don't know. If I think I see something on my notes that says they may give you numbers you need to know, then I will review that with you again. Okay. I will say, oh, know the numbers because on my note says they're going to ask you how many bones are in the face. You following me? I know this test question that always comes state and probably class. All this is part of the face except for what? Mastoid process is right here when next to the ear. Okay, that's called the mastoid process. It's not part of the face. What's the face is your frontal, your orbits, your nasal cavity, your cheekbones, aka zygoma, and your maxilla and mandible. Okay, that's all part of the face. What would be the except question that's not part of the face? Mastoid process. Got that? Be careful with the M's because they like to throw out words with M's, with the spelling M. Manubrium, mastoid process, which is the answer, maxilla, mandible. You're like, damn, which one is this? You have to remember each one. So if you remember what your instructor tells you or instructors and what I tell you, you should be okay. Okay. This, you know, that's pathophysiology. Highlight that in your book. Okay. If anything I know that they go out here to do with the skeletal system is what part of the bones create this? Red blood cells, white blood cells, platelets, and plasma. What part of the bone? Do you remember that?
What part of the bone?
And they always take these from patients to help another patient.
Marrow.
Bone marrow. Bone marrow produces blood cells, and all the blood cells, what I just stated, red blood cells, white blood cells, platelets, and plasma. Bone marrow. Make sure you know that, okay?
So it provides white and blood cells, no matter what
Yes.
cell it is.
Yeah, red blood cells, white blood cells, platelets, and plasma. You see the part here where it says helps create blood cells in the bottom of the PowerPoint presentation? That's what they mean.
Okay.
Okay, awesome. And then we get into musculoskeletal system. Form, posture, movement, protects vital organs. Highlight that in your book on 197. Go to 198, and this is what you must know. I'm going to show you right now. This right here. This is important. You must know this, okay? Type of muscles. I'm not telling you you need to know page 199 and know every muscle in your body. There's over 600 plus muscles in your body. We're not talking about, this is not EMT class, okay? This is the EMT class. So what you need to know, cardiac muscle, the heart muscle, leave it by itself. Cardiac muscle. When it comes to skeletal muscles, there's three names for that. These are the names I need you to know. Voluntary muscle, striated muscle, skeletal muscle. Okay? Please make sure you know it. I'll say it again. This one right here, skeletal muscle, is also AKA voluntary muscle or the word striated. Striated. Okay? You must know that. Now you're going to say, what about those smooth muscles, Nookie? That's easy. Ready? Smooth muscles, think of your intestines. Okay? So I want you to think of your digestive system. You know, small intestine, large intestine. Okay? So think of that. Think of your urinary system. Okay? Ureter, urinary bladder, urethra. Okay? That's all smooth muscle. And then one more, your blood vessels are smooth muscles. So a test question I would give to you guys would be, all the following is part of smooth muscles except. And if you see the word skeletal muscle, striated, or voluntary muscle, that's the answer. Because everything else I just mentioned would be part of smooth muscles. Things to do with your gastrointestinal system, your urinary system, and blood vessels. Anyone confused? No, beautiful. Awesome.
Can
Please.
you repeat the organs that the smooth muscles are comprised of? Please and thank you.
Okay, the smooth muscles, the three main ones they always talk about are one to do with your digestive system, which is like your intestines, the gastrointestinal. So I want you to think of, let's say, intestines, large and small intestines, and so forth. Okay, so think of digestives. If it's urinary system, I want you to think of the ureter, urinary bladder, urethra. Okay, that is to do with smooth muscle. And the last but not least, blood vessels. I do not want you to put blood vessels and be confused with that with cardiac muscles. Blood vessels fall under smooth muscles. Did you get it, Kenneth? Beautiful. And there goes all the muscles. If they look at this question, Louis?
You used to both voluntary muscles, striated muscles, and what was the third one?
Skeletal. You're talking about skeletal muscles, striated or voluntary, all one of the same. Cardiac by itself, and then smooth muscles is everything I just mentioned. And I think, yep, Kenneth is being a gentleman, and he's put it all down for you and type it there. What's good about this PowerPoint presentation also, and thank you very much, Kenneth, and the rest of you. Once you get this soon, it gives you both in that link what we write on the chat and what I'm talking about with you guys, okay?
Also, it'll
Say
save
guys and girls also. Say that again, Kelly?
so it will save automatically, like in the chat.
In the chat, it will have a section for chat that we wrote everything, and then they have the one for the video.
Gotcha.
So when I send this link to you, you're going to be able to click on me talking again with you guys, answering and talking with me. And then the other section will be everything that is written on the chat. So whatever Kenneth is doing or any one of you do there and put there, you should be able to see both.
Gotcha.
Awesome. What I see here that's always on test questions, trapeze right here, biceps and triceps, pectoral muscles, this on top, deltoid, okay, gluteus maximus, gluteus medius, quadriceps, okay? That's what I always see on test questions. I'm not saying you need to know every single one, okay? If you're that good, God bless you, okay? I'm sorry, I'm just stating. Because I don't even remember every one.
It's hard with all these big words.
Yeah, and it's a lot to know. You know,
Yeah.
the main thing is what Nuki's have spoken with you guys about that you need to know. I just want to make sure you understand.
Right.
So let's continue here. We went over that. We went over this. Okay, we went over the bones. We went over musculoskeletal system. We went over striated muscles, volunteer, and cardiac. Okay, this must know. I guarantee they're going to give you test questions on respiratory. Okay, please make sure you know this. I'm not going to go over every single one. They probably did this with you, but I'm going to go over certain things I always know that they ask questions on, and you definitely need to know. Okay, you need to know the difference between the upper and lower airway. Okay, you need to know words like this. Epiglottis. They're going to give you this saying this leaf-like flap. Okay, leaf-like flap. Oh, that's the epiglottis. What does it do? It helps prevent fluid and solids going down the wrong pipe, the wrong way. So going down the trachea. When you drink or eat something and you chew and so forth, it goes down your esophagus, which goes down to your stomach. Okay, so you need to know that. So know this word. I always see this on test questions.
I'll remember that because I had a trachea surgery here,
Oh, okay.
my throat.
So you actually had a tracheotomy there?
I did. Yeah, I did. And I had 20 bronchoscopies as well.
Wow.
Yeah.
That don't even see it looking at you when you went at his shoulder.
It's very deep. It's right here on my neck.
Wow. That's amazing. So people listen and learn, okay? The word stoma is the hole, the opening, okay?
Yeah, you'll feel it. It's like in between the collarbone. It's like your boy spots almost.
Well, remember here, that's above your sternal notch. So I know what you're talking. So if you're talking around your trachea area where your thyroids are,
Right.
okay, it's further down.
Mm-hmm.
Go that in order that you need to know. Now watch this. They may ask you a question on the larynx. We'll go over that in a minute, or the pharynx, or pharynx, all this together. Just know this, just in case they ask you. These are your test questions coming up that I always see. Lower airway. They love to hit you with the lower airway. Okay? So you know the larynx is your voice box. You know that? Okay? What I need you to know is the lower airway. Now, when you all breathe in, and they went over lecture with you, you know that the air goes in through here with your nose or mouth and down. When it goes down that trachea, this is what you need to know in order. Trachea, right and left main bronchi. Okay, so trachea, right and left main bronchi. That little piece right here, what is called the carina is where it separates or bifurcates. That's the words they use, the terms. So, in order, trachea, right and left main bronchi, that converts into smaller bronchioles and then into alveoli. In that order, please. Okay? Trachea, right and left main bronchi, bronchioles, alveoli. You need to know that. That's where your test questions are going to come. Okay? If they ask you this to do with your thyroid or something like that, when we look over that, you need to know that the thyroid is your Adam's apple. Okay? And it sticks out more in men than it would be in women. If they ask you what's underneath the thyroid cartilage, you know it as the cricoid cartilage. What is that piece between both of them? That's the cricoid thyroid membrane. And we're going to go over that in a minute.
It's the same. I'm sorry. It's the same name for a female and a male, right? The Adam's apple, as we call it.
Well, we don't call it the Adam's apple, but in the female, we call it the thyroid cartilage.
Oh, so it's different from if it was a male.
Yes. We like not to use the Adam's apple for the female because when we say the Adam's apple here, we like to say the thyroid cartilage because it sticks out more anteriorly than, let's say, you, okay, being a female. you hardly don't see it. So I always like to say, okay, your thyroid cartilage.
Gotcha.
If I say to you, God forbid, and a lot of you are going to laugh if I say this, damn, she got a large Adam's apple. I'm not going to think you're a female. I'm going to think you
Yeah.
are male. You understand? I'm
Gotcha.
gender friendly for everybody. So I don't care what you are, who you are, but you understand what I'm trying to say. Okay?
Right.
Now let's continue here. This is important. Words like respirations, you need to know. Words like ventilations, you need to know. We're going to ask you, where does gases take place at? Exchange at the alveoli. Know the word respirations. Respirations are to do with gas exchange of two gases. Which two? Oxygen and carbon dioxide. Now, if you remember how you breathe in, you need to know this. So when you write this later on and you're documenting all this, I want you to know this. When you breathe in, okay? When you breathe in, they're going to ask you, what are the two processes of breathing? You need to know is an active process and a passive process. The active process is inhalation, or which one would be the other one? Inspiration. The passive process would be exhalation or expiration. Most likely go with that. So a test question would be in a state of class, what are the two processes of breathing? If you don't see the word like active and passive, then look for inhalation and exhalation. That's to do with the active and passive of breathing. Those are the processes. Please make sure you know that. That's on test questions. That's in your book. We're going to go over that. Okay. When you breathe in, what muscles do you use? Besides the diaphragm, muscular dome. You need to know that these muscles, which I'm going to mention to you right now, always contract when you breathe in. When I breathe in or you breathe in right now, and you take a breath in, your diaphragm, which is right here, okay, contracts downward and flattens. Your intercostal muscles on your chest, your intercostal muscles go up and out with your rib cage. So up and out. So upward and outward. Do you use other muscles? The answer is yes, but I'm not asking that question.
Mm-hmm.
If I want to know the other muscles, I will ask that. So can we say that it's your diaphragm? Is your intercostal muscles? Is your abdominal muscles? Is it your pectoral muscles? The answer is yes, but I'm not asking that. You notice how I went a certain way and said, what muscles contract? Because that's what I always see on tests, especially the state. So in class, if they ask you that, you know it. Now, if you're confused with this, you remember that space between two lungs? Here goes the two lungs. Here goes that space. Okay, right here. You have 3 lobes on your right and 2 lobes on your left. There's not 3 here because it needs space for the heart between both lungs. So that space called the mediastinum is what? Your heart, your great blood vessels, your trachea, your esophagus, your thymus. Make sure you know that because that's always test questions. If you are confused of the flow of oxygen, I don't know, make up your own analogy. Think of a tree being turned upside down, okay? And that whole bark or trunk is the trachea, okay? And then the right and left bronchi is the main parts of that tree trunk. And then the branches that come out, those little ones, are all the bronchioles. And the leaves around that tree are your alveoli. That's the easiest way that you'll never forget it. Okay? They're going to ask you in order what does what. And you need to know the difference between respirations and this word, ventilations.
Okay.
When you ventilate a patient or they do some form of ventilation, All that means is the air right now here, this 21% air that's in your room, in this ambiance air or in your environment to your lungs. It's how and what you are utilizing to give the patient oxygen. There are 5 major devices we always talk about. Nasal cannula and non-rebreather is for a person that says to you, I need oxygen, I can't breathe. Okay, give them oxygen. So Nuki's saying to you, I can't breathe, I need oxygen. You put a non-rebreather on me. I said, no, it bothers me, I'm claustrophobic. Give me something else. You give me a nasal cannula. Nice, okay, I breathe a little better. But now if you needed to ventilate me, that's different. You're gonna use the other 3 devices if necessary. First one is the pocket face mask. The second one is the BVM. And the third one is CPAP. Know those. You're going to see that in the future on tests. Okay. So that's a lot to do with ventilations here and respirations. That's why I bring it out to you now. Okay. That's your upper airway. Just look at it, highlight it. That's in your book on page 200. Lower airway, upper airway. 198, 199, 200, and 201. Go to 202, and you see all the different muscles that you utilize up to 203. Here goes the words we spoke about before, thyroid cartilage, okay, cricoid membrane between that, and the trachea. We went over that already. Right here, you need to know. Test question right here. Divided into 2 lobes. Right lobe contains the upper, middle, and lower. That's 3 on the right, 2 on the left. So if I ask you a test question, how many lobes you have? You got to know you have 2 lungs, but there's 5 lobes total. But what are the ones called on the right side? Upper, middle, lower. What on the left? Upper and lower. Okay, you need to know that. What is the space between the lungs? Mediastinum. Okay, you need to know those words. We went over this to do with gas exchange in the lungs. They may ask you what's the plural. Highlight that word in your book.
Just give me a second to write that down.
No problem. I'll continue talking while you're writing down. Okay?
All right, no problem.
When you have the pleura, a layer of smooth glycerin tissue that covers each lung, there's 2 of them they always talk about. They talk about the pleura to do with the visceral pleura, which covers the lungs, and then the parietal pleura that lines the chest wall. You should find that to make it easier for you. And let me give it to you in the page so you know. It looks like it's on page 203 in the bottom. And 204. Okay? You're going to see a word called diffusion on 204. Make sure you know that word. That's a high concentration to a lower concentration. Bottom left-hand corner of 204. Make sure you know that. And then 205, they get into how you breathe. They're always going to give you this, okay? Right here, remember this? You have the thyroid cartilage, the cricothyroid membranes, and then there's cricoid cartilage. Mm-hmm. I want you to know these have other names. They call this rigid or hard circular ring, which is your cricoid cartilage right here. This is your thyroid cartilage, aka Adam's apple. Okay? This is the membrane. So you needed to breathe because the upper airway, something was wrong with it. One of the first things they would do, they would cut an opening here and place a little tube there like the pen so you could breathe through that. Okay? Mm-hmm. They're not going to do what Kelly had. They're not going to get into that stoma and that big tracheotomy and all the other stuff she said she went through. Okay, no, we're just talking like this little so-called MacGyver Boy Scout kind of thing. Okay, that's what they're gonna do.
Yeah.
Okay, look what here. Remember the muscles I said that you breathe with? If they ask you the question like that, diaphragm, neck, cervical muscles, intercostal, abdominal, pectoral, these are all the muscles that help you breathe. But I didn't ask that, okay? Then here goes inhalation, exhalation, and that's simple. Any questions so far on respiratory? This is the time to ask before we continue. All right. These words you must know right here. Respirations, which I went over, and the word diffusion. So while you're writing that down, I'm going to explain something here. Remember the respirations. The word is to do with the changes of carbon dioxide and oxygen at the alveoli. Please know that. Make sure you understand that. If they ask you the word diffusion, is the passive process which these molecules go from a higher concentration to lower, higher to lower. Picture Alka-Seltzer, that big white piece of Alka-Seltzer, and you drop it in water. You notice that the Alka-Seltzer is like that huge tablet, and when you drop it in water, it disappears.
Mm-hmm.
Use that analogy like higher concentration to lower. Okay, that's the easiest way to like visualize it. All right. Now they're going to give you, when you breathe in, what makes you breathe normal? You all here very healthy, and myself, how do we breathe normal? The healthy person, the regular person. We breathe normal because we have an increase of carbon dioxide in the arterial blood. Okay? That is picked up at your aorta and your carotid arteries. Okay? So make sure you know that. So right now, every one of us are breathing normal because the body sends an increase of carbon dioxide in the arterial blood. Now you're going to say, yeah, but the book also talked about the cerebral spinal fluid. Yes, it does. Okay? But I want you, in the pH levels, I always see test questions to do what I just mentioned. Okay? You can read that section again. I think it's on page 205, and it starts on 204, chemical control of breathing. So this is what happens. When the aorta or the carotid arteries pick up an increase of carbon dioxide, it tells the brainstem, guess what? I want you to let the pharynx nerve and the diaphragm know to breathe normal. So the brainstem, aka medulla oblongata, also will say, guess what? Pharynx nerve, tell the diaphragm to breathe normal because I sense an increase of carbon dioxide in arterial blood. That's how you breathe normal. You see this word hypoxic drive, aka what? Your backup. The backup system to control respirations, okay, are always the stimulus to breathe on low levels of oxygen. I want you to think of people with lung cancer, emphysema, chronic bronchitis. They work a lot on low levels of oxygen. Okay, make sure you know that. Look at the brainstem. Breathing by monitoring carbon dioxide, blood, and spinal fluid, right? But the main one I always see is increase of carbon dioxide in the arterial blood. Okay, make sure you know that. Any questions on that? The book talks about breathing occurs when you have a buildup of carbon dioxide and cerebral spinal fluid that causes your pH to decrease. Okay, I rarely see that exactly on exams. You can highlight that in your book, but what I always see on the state, especially arrows saying increase of carbon dioxide or carbon dioxide and so forth. So make sure you please know that. You're going to go to the nervous system controlled breathing on page 205. And you're going to see words like this. Look what you have here. The medulla initiates ventilation cycle stimulated by high carbon dioxide levels. That's what Nuki stated before. That's what I need you to know. Okay? Please make sure. Can we say that the medulla oblongata is responsible for initiating the ventilation cycle? The answer is yes. But your primarily stimulus to breathe is high carbon dioxide levels in the arterial blood. Make sure you know that, please. So you know how it sends the signal to the pharynx nerve and to the diaphragm for you to breathe normal. We already went over the word ventilations. Highlight that. This you must know. This one right here. Tidal volume. They're going to ask you tidal volume. You have to know the word tidal volume. Tidal volume, the amount of air that moves in, to, and out of the lungs in a single breath. So when you go like this, you see in a scenario-based or critical thinking question, reduction in tidal volume, reduce in tidal volume. That's not normal. You need to know that you breathe normal the way I'm talking about. Okay? So know that word tidal volume. You can highlight the word residue volume. This one I always see, dead space. Dead space, the portion of respiratory system that has no alveoli and little no gas exchange. In other words, it never really reaches the alveoli. It's just there, it's trapped. Okay? That is your dead space. Make sure you know that. And then you need to know the characteristics of breathing. And that's on page 207 and 208. You're going to get words like adequate, normal breathing, and then inadequate, which is abnormal breathing. You need to know and know the signs and symptoms of that, how it looks. So if I'm breathing normal, I'm going to have good tidal volume. Okay? I'm going to have good movement of my abdominal muscles, my chest muscles, my intercostals, my rib cage, and everything. It's going to be regular when I inhale and exhale, okay? There's not going to be no weird sounds coming out of my lower airway, okay? That means I'm breathing normal. So make sure you know the characteristics of that. And here it goes. If I'm inadequate, you may have shallow respirations, labor respirations, muscle retractions. You may be pale, cool, diaphoretic. You may be put in a tripod position like this, that the patient you come to is leaning like this with their hands on their knees and leaning forward and trying to get air in, okay? All that's inadequate. Make sure you please know that. Very important. And these on page 207. And there goes your inadequate, also 207. Probably 208. Before I continue, can anyone tell me what is your normal breaths for the average adult?
12 to 20.
12 to 20. Excellent. 12 to 20. Okay, make sure you know that, because if they ask you that, you need to know that. You need to know these numbers too.
What was the question again? I'm sorry.
The question was, what is the average
Respiration.
respirations on a normal adult? You know, the average adult. 12 to 20 breaths per minute. But be careful.
Okay.
Because I'll give you this. Let's say it's me or patient, and I'm breathing 24 times a minute, but my CTC is all good. Pink, warm, and dry. CTC. Pink, warm, and dry. But I'm breathing 24 times a minute. I'm over that 20. Could that be Nuki's norm or that patient's norm?
Nuki's norm?
No.
No.
You think it's no, but it could be yes because of their history.
Mm-hmm.
So that could be their norm. The numbers you really need to know is these two. Always test questions. 8 or less or 28 or more. I'll say it again. 8 or less or 28 or more. EMTs ventilate, medics intubate. In other words, besides those numbers, that rate that you see, 8 or less or 28 or more, you got to be careful there because it shows other signs of symptoms of the patient being pale, cyanotic, cool, clammy skin, possibly tripod position. There's a problem there. Reduction or reduced tidal volume. Okay? Most likely, this patient may go unconscious on you or unresponsive, and you have to ventilate using the BVM, pocket face mask, and so forth. So make sure you know the difference. You good, my love?
Mm-hmm.
Okay.
Oh, you have no water.
No, only one in the bottom now? All the way in the bottom?
And one there.
You can take that one or this if you need it. Okay? We are up to the heart. You are going to get respiratory and heart questions. I'm telling you this right now. And the nervous system questions, probably on your first exam. And I think one of you, Lewis, or one of you stated, or I think it was Kenneth, possibly administration stuff or admin stuff, they call it. And what was the other one? Possibly the, what was the other one you said, Kenneth? Oh my God.
Oh, human body 1, vitals, lifting and moving, admin and requirements.
Thank you. Okay? That's what it's going to be on. Okay? So we'll try to go to a lot this evening. Okay? There's 2 words you must know. Now, who here is having problems with the heart? And be honest. No? Okay, so you feel comfortable. Okay? So you see where it says systemic circulation and pulmonary?
Mm-hmm.
You need to know that each one of these 2 circuits, systemic circulation, body, left ventricle. Think of the left ventricle contracting, and that's how you get everything going to the body that's oxygenated, rich oxygen. So systemic circulation carries oxygen, which is rich in blood, from the left ventricle to the body and back to that right atrium. That's how it begins. The pulmonary circulation carries the poor blood, the deoxygenated blood, from that right ventricle through the lungs and then back to the left atrium. In other words, there's a sequence I call the figure 8. Okay? How blood flows through the body. You need to know these. These are always test questions. Ready? The aorta, the largest artery of the body, the aorta. Then it goes into arteries. Then from arteries to arterioles. From arterioles to capillaries. From capillaries to exchange. Okay? Then it goes to veins, superior, inferior. I'll do it one more time. Aorta, largest artery of the body. Okay? Arteries. Arterioles. Capillaries, exchanging. Veins, superior and inferior vena cava. I will send you like a figure 8 diagram of the flow of blood and videos and things like that. Please make sure we make this. This will help you so much. I'm going to state it now, even on this Zoom recording. I am not your senior instructor. I'm just one of the senior instructors to help you all in your class, all 20-something of you, okay? The ones you listen to is Irene, I think, who's your senior instructor, and Yadira, okay? What they say goes. What Nuki says here is just to help. What I send you is just to help, okay? I don't want you going back, but Nuki said no. Yes, I have more years than probably the 2 instructors that are teaching you, but that has nothing to do with that, okay? Maybe when I first started EMS, Yaduro was maybe a toddler or preschooler. I'm not sure how old he is, maybe 30-something, okay? But I'm doing this over 31 years, okay? So please make sure you understand that. So it's on the recording. Don't say what Nuki said this and this is what the WhatsApp said. No. They're going to look at you, well, why did you accept and created a WhatsApp with Nuki and all this other stuff? No. I don't want to hear that crap. Okay? I want to make sure I'm helping you all. So please, I clarify that.
I think Yadiro said he was like 39.
Devin, God bless you. You heard that, mommy? I'm 39. You know, Devin, you know, I would kiss you, but then they're going to think other things about me. I don't want to do that, okay? No, I'm way older than that, 39.
No, Yadiro said he was 39.
Yadiro's
Oh,
39.
was
Yeah.
Yadiro. I thought you said I was 39.
No.
I said, damn, Baba, you're not looking real good on this bald head. Okay. I used to have hair. No. Nuki is 62.
Nuki felt 39 for a second there.
I'm 39.
Yeah, I shouldn't have said anything
No,
after that.
It's all right. Listen, I don't mind saying my age. I feel I look pretty decent for a person who's getting close to that elderly, you know what I'm trying to say? Don't let the age and the number fool you. This is
Geriatric.
Geriatric. There you go. That's right. You see, 65 or older considered geriatrics, you know? Looking at this heart, you need to know the heart. You need to know the flow of blood. Okay? This is the flow of blood. I'm going to say it to you. It's on the video. You'll know it. I'll go in and I'll send it. All your deoxygenated blood is on your right side of the heart of you and your patient. Okay? So whatever's in the lower portion of the body, inferior, and what's on the top, superior, that deoxygenated blood goes to the right atrium. You see it in blue. It goes from the right atrium down the tricuspid into the right ventricle, still deoxygenated. It goes up the pulmonary valve into the pulmonary artery, still deoxygenated, to both lungs. Does its job at the lungs, okay? Comes back from both lungs with fresh, rich, oxygenated blood into that, and you see it in red, called the left atrium via the pulmonary veins, the only veins that are oxygenated. Remember what I stated before? The pulmonary arteries, the only arteries that are deoxygenated. So you need to know that, because technically, can we say that mostly all your veins are deoxygenated except the pulmonary veins? Yes. Can we say that all the arteries are oxygenated except for the pulmonary artery? The answer is yes. You need to know that. So let's continue with the flow of blood.
Wait, so they're both oxygenated, the pulmonary vein and the artery as well?
No,
No, so the difference is the vein is oxygenated.
the pulmonary vein.
Okay.
The pulmonary vein, write this down. The pulmonary veins that come from the lungs via the pulmonary veins are the only veins that are oxygenated. Now write this down. The pulmonary arteries, okay, are the only arteries that are deoxygenated, right, coming from the right ventricle. You got that? Because you need to know this. Can we say, other than those two I just gave you, that all veins are deoxygenated? Yes, except for the ones I just gave you. Can we say that all arteries are oxygenated except for the one I gave you? Do you understand that now, Kelly?
I do.
Everybody else is good. Beautiful. Because you need to know that. And when I send you these other videos and things like that, it's going to make it easy for you. You need to know that. So let's continue here. So we got the oxygenated blood from both lungs via the from both lungs via the pulmonary veins. You got it going into the left atrium, down the bicuspid into the left ventricle. Of course, it contracts, goes up the aortic valve, into the aorta, to the rest of the body, all oxygenated, fresh, rich, oxygenated blood. You need to know that flow of blood. They always ask you test questions on that. So that's why I always go over this and I take my time here, because you need to know that. You need to know how many valves you have, 4. How many chambers you have, 4. Now watch these words. You must know that. The heart is divided in half. Right side, left side. You need to know that the right side of the heart is always deoxygenated, whole blood. Left side of the heart is always oxygenated, rich blood. When it's divided in half, it's divided by the septum. Okay? Now watch this. You can make a Valentine's Day heart, or you can make a square box. Okay, and watch how Nuki does this, and you should never forget this now. Each chamber, upper chambers and lower chambers, the upper chambers are called atriums. The lower chambers are called ventricles. Okay? Now, you know there's 4 chambers. Now, here goes test questions 2. What 2 valves separate in the atrioventricular valves? Now, watch this. Atrioventricular. There's 2 valves that go from the top to the bottom. Atrioventricular. Ready? Tricuspid and bicuspid. Bicuspid, aka mitral valve. So they ask you a test question. What 2 valves are the atrioventricular valves? Well, all you got to say, okay, atrials on top, ventricles on bottom. That's atrioventricular. Tricuspid, bicuspid. If they ask you what are the 2 other valves, they're called semilunar valves. Semilunar valves. That is your pulmonary valve and your aortic valve. You must know that. Any questions on valves so far?
You said semi. The last one was semi what? Semi what?
Semilunar, like the moon, semilunar.
Oh, semi-luna. Okay.
Okay? So please make sure you know that. It's very important for all of you to understand this, okay? There it goes. Upper chambers, lower chambers, okay? The heart, hollow muscular organ, size of a fist. Circulation, right side, aorta, right side, deoxygenated, left side oxygenated. I said all this already, okay? That's the flow of blood, how it comes down. And you see the arrows from the bluish to the red is just the flow of blood and everything. You need to know that. So if there's anyone here confused of the flow of blood, Kenneth, Devin, Isaiah, Louis, Kelly, Alejandra, if I said it correctly, my Spanish is terrible. She's going to beat me up.
Yeah, you said it right.
Okay. Thank you. Just want to make, I don't see your face, so I just see a picture of you. Are you at work?
Oh, no, I'm here. I thought it was on.
Okay. I just like to see who I talk to. You know what I'm saying? Just in case. There you go. Don't worry. Nuki does not bite me, huh?
Okay.
Oh, I was just doing her trying to rattle the other day.
Yeah.
Don't listen to my crazy wife behind me, okay? When I tell you I don't bite, she said, yes, he does. Don't listen to her. Ella loca. Oh, Margie, I'm going to beat you up. She is so mean. So I want to make sure you all know this. Now, here, test questions right here. Please know this. They're going to ask you, what is cardiac output? Amount of blood moved in 1 minute. What is stroke volume? The amount of blood moved in 1 beat. Make sure you know that. How do you get cardiac output? You take the heart rate times the stroke volume gives you good cardiac output. You need to know this. You need to know that the average beating right now for all of you, nosotros, every one of us, is 60 to 100 depending on your history. Now, you know how Hispanic people eat and Afro-American people eat, Caribbean people eat, even Caucasian people eat, okay? You know how we eat, depending what we want. Some of us eat healthy, some of us don't. So the average heartbeat is 60 to 100. You need to know that. Anything less than 100, anything less than 60, bradycardia. Anything more than 100, tachycardia. You need to know that. You need to know those terms. They will ask you questions on that in the state and probably in class in the future, especially to do with the heart. Okay? Any question on that or the formula?
No.
Okay, now you need to know this. You're going to see the words electric conduction system. Okay? That when you turn the page on page 207, you go to 208, 209. I want you to highlight those things that you see there. The heart, the normal heartbeat, circulation, the formula, you go to 209, you read that section, and then you go to 211, 212, and 213. This all to do with capillaries and veins and arteries. Highlight that and know what they are and what they do. Okay? What I have to talk about right now that's important is your electrical conduction system. They're going to ask you, what is the pacemaker of the heart? You need to know that's the SA node. Under the electrical conduction system, your heart knows exactly what's its job. And it needs to beat between 60 and 100. That is the pacemaker of the heart, aka SA node or sinoatrial node or sinus node. You need to know that. It beats from 60 to 100 times a minute. Pacemaker of the heart. When that fails, the backup for the SA node is the AV node. AV node. That's the backup, and that beats 40 to 60. If those two mess up, which is the SA node, 60 to 100, and the AV node, 40 to 60, they both mess up. You have this thing called the Purkinje fibers located in the ventricles. They say, guess what, guys and ladies? I got your back. AV node, SA node and AV node, you guys messed up, but I got you. But I only could give you 20 to 40 beats per minute. At the ventricles, that's the backup. So know the electrical conduction system, which is this. Okay? It's in your book. That's what you need to know.
What chapter is that on? I'm sorry.
Say that again?
Nuki, what chapter is that on in the book?
Oh, this is all on chapter page 214, 215. Let me start exactly where is that.
Okay.
Okay, 209, electroconduction system. 209, 210, 211. Okay, you need to read that section again. When you read 211 on, it's going to talk about arteries, all the arteries, pulmonary artery, and so forth. It's going to talk about the veins and capillaries on 212 and 213.
All right.
And it's going to go into 214, more with veins, and then the blood composition. And we're going to go over all that on 214. So make sure you know those. Okay. I would try to get you that thing as soon as possible.
Okay.
All right.
Thank you.
Thank you very much, Kenneth. You're welcome. 40 to 60, AV node, 60 to 100, Purkinje fibers. Thank you, Kenneth. I appreciate it. This is your arteries. They'll talk about that. Very simple to know. Ready? Coronary arteries surrounding what feeds the heart. You need to know this one. Okay? So think of these. Carotid in the neck, liver, and kidneys. Pulmonary artery, that's the one that goes from the right ventricle past the pulmonary valve into the pulmonary arteries to the lungs. This is the one that is deoxygenated. You need to know that in case they ask you. Now, see this word? Arteries branch into smaller arteries and then into arterioles. Arterioles branch into series of increased smaller vessels until they connect to the capillaries. You remember when Nuki went down from the aorta to the arteries, to arterioles, to the capillaries? That's what I was trying to discuss with you. You need to go and highlight this in your book and know what size they are, how they become smaller, and so forth. Remember this, easiest. AA, arteries away from the heart. Okay? Arteries away, veins to the heart. Did I confuse anybody? AA, arteries away. If you notice, almost every artery we talk about, from the aorta to the arterioles to the other arteries, they all go away from the heart. And if you notice, all the veins go to the heart. Superior and inferior vena cava to the heart. Pulmonary vein to the heart. That's the easiest way to understand all this. Okay, talked about pulse. Make sure you know the pulse. Highlight that in your book. Force pumped by the left ventricle. Then they're going to give you a diagram here. The ones you need to know on page 212 that I see always on exams. You can highlight this if you have it. If you don't have your book in front of you, write these down. This is the easiest way to go through it. You must know the carotid arteries. I always see these on test questions. So just put carotid. Subclavian, right here. This subclavian artery. Okay, you notice it comes on each side from like the upper arm portions in the chest above the pecs, right?
Mhm.
Then you have the pulmonary artery. Highlight that. That's the one that's in the heart area. Pulmonary arteries, that goes towards the lungs. The aorta, okay? The largest artery of the body, the aorta. The brachial artery, to do especially for infants when you're doing CPR. You're going to check the brachial artery that is between the bicep and tricep of the infant. Know that word, brachial.
Yeah.
The iliac, okay? Iliac arteries. You know the radial and ulnar arteries, that's on your arm. The radial is right next to your thumb side, and your ulnar is next to the pinky side, okay? Now go straight down here to the legs. You're going to see these big femoral arteries, okay? I want you to go further up because they're really just below here. And that's where you could palpate it and feel the femoral artery on both legs, okay? So know the word femoral artery. The popliteal, just behind the knee, okay? Popliteal, this one. And then these two I always see on tests also. Posterior tibial, like inside the ankle, more medial, and dorsalis pedis. Just follow the big toe on top, about 5 inches up, and that is your dorsalis pedis. I see all those always on test questions. Please make sure you know that. I'm not asking you to know every single artery here. Okay? If you're that good, God bless you. Okay? Know what capillaries are. Know what veins are. You highlight that in your book, and I gave you the pages already. This you must know right here. The spleen. That's on page 215. And then the composition of blood. So, if they ask you, the spleen, what type of organ is? It's a solid organ that's very vascular. Okay? The spleen is very vascular. If you want to know the ones that we always talk about that are very vascular, okay, pals. And these are all hollow ones, slugs. Okay? The reason why I bring this out, because if you look at OK PALS, this is a mnemonic or acronym for everything that is solid that we deal a lot with and we talk about, especially in the abdominal cavity area, okay, or abdominal pelvic area. Ovaries, kidneys, pancreas, adrenal glands, liver, and spleen. They are very vascular. They bleed easy and a lot if injured. The slugs are all the hollow ones, okay, that we deal with all the time. Small and large intestine. The U would be things I want you to think: urinary, ureters, urinary bladder, urethra. Okay, the G, think of things gastrointestinal. Okay, small intestine, large intestine, esophagus, things like that. And then the S, also the G, I want you to think of the gallbladder. Gallbladder, that also is hollow. And then the S, the stomach, hollow. So you know, okay, pals, everything that's solid. Slugs, everything that's hollow in the abdominal pelvic cavity. Any questions on this?
Can you repeat the OK pals?
Okay, okay, pals. Ready? Ovaries, kidneys, pancreas, adrenal glands, liver, spleen. One more time. Ovaries, kidneys, pancreas, adrenal glands, liver, and spleen. Got it, Louis? Awesome. Okay. Alejandra, which is a nice name. Alejandra, can you tell me and give me another name for red blood cells? And if you're not sure of it, I'm going to help you out. Go to page 214.
214.
I think it's in 214. Hold on. I think it's 214. I just saw it.
Yeah, it says blood is composed of plasma, red cells.
I just saw it.
Yeah, I think it's 214, but I'm having trouble pronouncing it. Is it every?
I got it for you. Don't worry about it. Erythrocytes.
Yeah.
Erythrocytes. Okay, beautiful. Red blood cells. Okay, Devin, white blood cells.
Hold on, I'm looking for it.
It's okay.
Leukocytes.
Leukocytes. Okay, Kelly, another name for the liquid of the blood. Another name for the liquid.
Liquid.
If you don't know it, it's okay. Say, Nuki, I don't know. It's okay. Está bien.
I don't know.
Yeah, it's all right. Listen, it's us, people. It's Nuki. I'm not going to bite the
Plasma.
off. Not like the word. Plasma. Thank you, Isaiah.
Plasma?
Okay?
Okay.
Now, the last but not least, these things that do the clotting, what are they called?
Platelets.
Anybody? Kenneth?
Platelets.
Platelets. So you need to know these terms right here. Okay? You need to know these terms. And you need to know the word blood pressure. What does blood pressure do? Okay, you need to know that. Okay? So here you got the plasma, the liquid portion of blood, which contains a watery component, proteins, okay, component, and oxygen and carbon dioxide and nitrogen. Nice to know, and nutrients. That's cool. That's your plasma. Your red blood cells, aka erythrocytes, contains hemoglobin, which carries oxygen, and then the white blood cells, leukocytes, plays a role in the body's immune system to fight infection. It's a defense for infection. And then your platelets is for clotting formation. You need to know that. It's going to be in the video. So now you know all that. Okay? Now you need to know blood pressure. The blood pressure, how do you get it? Is the pressure that blood exerts against the walls of the arteries. Have they go over with you guys in skills yet to do with doing blood pressures, pulse, and respirations and sample and things like that?
Yeah, we did all of that on Thursday. We
And
did all the way
skills,
up to we did all the way up to pupils.
Yeah.
Beautiful.
Vitals.
Pupils. So when we go over that in the future, we have a good questions and we go over that. I will help you tremendously of how to have a better understanding and how to do certain things. Okay, so you have this, now do this. You know, I lost track of time. My apologies. Jesus Christ. It's 7:50. Let's take a break for a few minutes. Forgive me, all of you.
It's okay.
No, you got to remind me. I could just talk and talk and talk and forget about track of time. And, you know, I'm diabetic, so I got to check my sugar and I got to eat something too. How many minutes you ladies and gentlemen would like to take?
It depends on you.
No, it's up to you. Listen, I'm here for you guys and ladies. You tell me.
What time
5
is
minutes, 10 minutes, 15 minutes. You tell me. We only can stay here tonight.
15?
15?
Yeah.
Okay, we'll all take 15. It's like 7:50. So we come back at what? That's 8 o'clock. 8:01 is 10 minutes. 8:06.
Okay.
We'll come back at 8:06 and we'll try to finish a lot of this and a neurological, and then I'll get into other things I want you to know. Okay?
Okay.
All right. See you guys and ladies in 15. I'm going to pause the video.
Alrighty.
Okay. Pause. Recording.
Recording stopped.
And I'll see you all in a few. Okay, on the screen, you should see talking about the circulatory system, blood pressure, systolic and diastolic. You need to know this all the time. Test questions we always give you is to do with what is the difference between systolic and diastolic. Make sure you know that. Systolic is when the ventricles are contracting, especially that left ventricle, okay? And then the diastolic is when it's relaxing, filling up. So you need to know the word systolic and diastolic, okay? Make sure you know that, please. You need to know this word perfusion, aka, okay, perfusion, that good circulation of blood in the organs and tissues to meet the adequate amounts of needs for the cellular level. In other words, perfusing the circulation of blood in a organ or tissue in adequate amounts to meet the current needs of the cell. So it goes all the way down to the cellular level. So when you have good perfusion throughout your whole body, that's the word you need to know. If you have the word hypoperfusion, also called shock, a person in hypoperfusion, also called shock, is the inadequate blood supply to the organs, tissues, and cells. You need to know that in case they get you a test question on that.
Shock as in like car accidental shock or like brain shock?
No, shock like in hypovolemic shock, neurogenic shock, septic shock,
Okay.
compensated shock, decompensated shock. The word shock is hypoperfusion. There are many different types of shock. When you get to that section, I will break it down to you when we review again, that you'll never forget it. I have certain techniques and certain ways of doing things that you're going to know every shock out there. And there's about 13 different of them that you need to know. Okay, I'm going to give you distributed shock, obstructed shock, cardiogenic shock, hemorrhagic shock, hypovolemic shock, insulin shock. You're going to say, damn, Nuki, how many shocks are there? But they're very easy because when I break it down in mnemonics and then each section. And then you'll say, that's easier when we get there, okay? Just think of this word hypoperfusion, aka shock.
Okay.
That's it for right now.
Okay.
I'm not worrying about these right now. This you can look over in your book. I want to get to the neurological. This is also going to be on your exam. Okay? I know how they do exams and what they do in class, okay? You need to know the nervous system. That's going to start on page 220. 220 A and P, okay? This one here is on page 218, nervous system control of cardiac system. You can highlight this, know the difference between the sympathetic nervous system, which is your fight and flight, and then your parasympathetic nervous system, which is your feed and breathe. In other words, if I was to scare one of you and I go to Alejandra and I say, boo, and then Alejandra goes, oh, right? You scared me, right?
Mm-hmm.
That's a form of shock, what we call psychogenic shock. But if I scare her in that way that she panics and start getting very nervous and wants to like fight me back, or she runs, that's called the sympathetic shock. Okay? Sympathetic, I'm like brain farting here and I just finished eating. Sympathetic nervous system. That is the fight and flight. So everything increases. Blood pressure, pulse, respiration, pupils become dilated. She may start sweating and so forth. So that is what we call sympathetic nervous system. If I say the parasympathetic nervous system, it is the opposite. Everything starts decreasing and functions more to what we call the digestive system, the feed and breathe, the rest and digest. So everything would be the opposite. Okay, so know those two terms in case they ask you. This epinephrine, your body already produces it. You know it's at adrenaline, okay? You need to know that just in case. So you see where it says here, stimulates the heart, blood vessels, that fight or flight, everything's increased. This parasympathetic nervous system, that's the one I need you to know. That's the opposite. That parasympathetic nervous system causes the heart to go slower, beats more weakly, okay? Everything's shunting towards your digestive system, okay? Your breathing goes down, your pulse goes down, everything. Because now the body knows exactly what to do. So it's going to take the necessary blood where it's needed from your skeletal muscles and so forth and bring it towards your digestive system. We all just maybe finish eating something, right? I know I did, probably Alsea did, and the rest of us, right? Did you notice that right now, after you finish eating, a few minutes after, you start getting tired? You're feeling like, relaxed, like you just want to be under somewhere and just watch the game and maybe fall asleep, right? It's because you're tired. It's not that you're tired, it's that your parasympathetic system is working. The blood is taken, shunting away where it's not necessary right now and going towards your digestive system. That is your parasympathetic nervous system. It's called the feed and breathe or rest and digest. Know that for the future, okay? Now, this you need to know. I want you to think of your computer, your brain here, as your CNS, your central nervous system. It consists of the brain and spinal cord. You need to know that. Always test questions. The peripheral nervous system, this one, I want you to think everything to do with your extremities, okay? So everything to do with sensory and motor, okay? Know that. Because when we're going to get to this more, and you can say, okay, I know the difference now. So peripheral nervous system, the nerves outside the brain and the spinal cord. They have like this reflex arc. You ever touch something that's too hot and your hand jumps real quick off of it?
Yeah.
That's your peripheral nervous system. It knows exactly to do with sensory motor. That's too hot or that's too cold. Okay? So it knows what's to do. If you see the word somatic nervous system, SOMATIC, nervous system, that regulates everything else to do with like you walking, sewing, talking, writing, things like that. If you notice, it's everything that's almost what? Voluntary, right? And then the autonomic nervous system, that controls other body functions that you have no control over. It's automatic. Your heart, your digestive system, your urinary system, okay? That you need to know. If you want to know this and that for the page, I want you to go to 220 and then know all these parts right here. Always test questions right here. We will ask you, and this is on page 220 and 221, we want you to know the cerebrum, cerebellum, and brainstem. Easiest way, okay? The cerebrum, largest part of the brain, okay? Surface we're made up of neurons, responsible for high brain function, and can be divided into halves or hemispheres, they call them, okay? We want you to know that you see things like the frontal lobe, the parietal lobe, okay, the occipital lobe, the temporal lobe, and so forth, okay? You need to know that when it comes into that part to do with the cerebrum. The cerebellum, okay, I need you to know that word. That cerebellum, I want you to think of it controlling movement and muscle coordination, like balance and so forth, okay? So the cerebellum, you're thinking of it controls balance. If you always don't want to forget that word, just say this, cerebellum, cerebalance. You know that it controls balance, coordination, and so forth, okay? That's the easiest way to remember. When you say the word cerebrum, remember what we just spoke about, largest part of the brain, and think of everything else it controls. Now, when you get to the brainstem, this right here, you need to know it controls the vital functions of life. They're going to always ask you test questions on that. Okay? And what are the vital functions of life? Your blood pressure, systolic and diastolic. Your heart rate. Your respiratory rate. And your book even talks about pupils and swallowing. But I want you to know the first three I gave you. I always see that on tests. So know the brainstem. So when you think of the vital functions of life and you think of the brainstem, make sure you know that. Cerebrospinal fluid, you need to know this. This protects the brain and the spinal cord, even with the meningenes, okay, that are in the brain surface area, the meningenes, okay? But the cerebrospinal fluid, you need to know that. Cerebrospinal fluid, known as CSF, it cushions the brain and spinal cord, okay? Please know that, very important. There goes your spinal cord, how it looks. And then this is the ones I said before. So what did I say that the somatic nervous system controls? It's voluntary. What will you tell me? I can't hear you. I see some lips moving, but I can't hear you. Lewis?
Anything that's voluntary, like walking,
Yeah, exactly. Walking. What else? What you doing right now to me?
speaking.
Speaking, talking, right? Writing, sewing, you know, think of everything voluntary, called the somatic nervous system. What's the autonomic nervous system? What does that control?
Anything that's automatic.
Yeah, automatic, involuntary, has no control. You have no control of it, right? So you need to know. So think of these right there. Always test questions right here. You better know this. Somatic nervous system and autonomic nervous system. And look at your autonomic nervous system when it comes into those two areas of the sympathetic nervous system, fight and flight, and the parasympathetic nervous system. Okay? Remember what I said about both of the sympathetic nervous system? Everything increases, the fight and flight. Parasympathetic nervous system, everything slows down, right? In the body. It's shunting, especially towards the digestive system, the feed and breathe, the rest and digest. You need to know that in case they ask you test questions. Now, any questions on these? This for you, page 221, and also 222, 223. Peripheral nervous system, 223. 224, you must know the motor nerves, and the other one that's called the sensory nerves on 223 and 224. That's very important to know. And if you notice this coming up to do with the peripheral nervous system, but to do with the sensory nerves also, it's right here. Look what it controls there. Carries information from the body to the CNS, which is central nervous system, and motor nerves carry information to the CNS, to the muscles. So that's when you do that reflex and everything. So if you ask somebody, can you feel this, or you could touch that, you're checking motor and sensory, okay? When you're checking a pulse, you're checking circulation and so forth. So here, know this to do with the peripheral nervous system. And that's on page 224. Now, we're going to get into parts like this to do with your skin. You want to know that? Page 225. So when you go back to this, I think a lot of you stated to me they have not gotten up to this, right? In the human body, did they get up to this or no?
No.
You're going to be ahead of the ball game because you're going to get another exam called part 2 of the human body.
Yeah, we stopped right before nervous system.
There you go. Now you're going to have extra. So I'm going to give you a lot of things extra now so it can prepare you probably for the next one. Remember, next Sunday, we will be going over other things that will help you for the next exam, which will be part 2 of the human body and whatever other things they put on it. Okay? So let's go over this. You got technically 2 layers of the skin and then the subcutaneous fat. Some people call it 3 layers. Okay, whatever you want to say. Epidermis and dermis, subcutaneous fat. You need to know the superficial part and the deeper part. Okay, top, bottom, and then more inner, what is the subcutaneous, and that's on page 224. When they give you test questions, okay, it's going to be a lot to do with the dermis. The epidermis is not too bad, but what contains almost everything is that dermis. And I'm going to show you on the next slide. Here is these, where you see the line going across. But when you get down to the dermis, the next layer, you know it goes from here to here and across. They're going to say, of the following, this part of the skin has this, this, and that. Nerve, sweat glands, hair follicles. Oh, that's the dermis. All these are part of the dermis except. That's how we give you test questions. So you need to know the epidermis, the dermis, and the subcutaneous fat. Okay? Make sure you understand that. It's very important. Right here, always a test question. So know all 3. And then the remainder of it. The skin is the largest single organ in the body, and 3 major functions of what it does. Protects the body and the environment, regulates body temperature, and transmits information from the environment to the brain. That's what they want you to know. Not too much on the skin. Gastrointestinal, you need to know all 4 quads. Okay, you're going to find that on page 226 and 227. You must know this, okay? All the quads. The easiest way to know all these quads, and I'm going to break it down for you, that you'll never forget it. All the 4 quads, I'm going to show you the next slide that I want you to break these quads the way you see it on this diagram. You see this umbilicus right here, where I'm putting my mouse? And you see the line going across? And then from here down to the genitalia area.
Mm-hmm.
You notice here, this is the right upper quad, the left upper quad, the right lower quad, the left lower quad. Here how they give you test questions and what I need you to know. In this right upper quad, write these words down. LGS. That mnemonic stands for liver, gallbladder, small and large intestine. That is in your right upper quad. In your left upper quad, write these words down besides the mnemonic. The mnemonic or the acronym is going to be PSSS. Psst, psst. Pancreas, spleen, small, large intestine, stomach. I don't care which order you put the S, all 3 S's, whatever. Please make sure you know it that way, and you'll thank me in the future, okay? The reason why, they're going to give you test questions or ask you test questions. What's located where? What is its function? If you have a direct pain there and a referred pain, you know how to separate all these things. The right lower quad I have, and the left lower quad, I have no mnemonic for it or acronym. You have to make it one up your own, okay? But this is what you need to know that's there. On the right side, you have everything on the right side. I want you to think of your right ureter, your right fallopian tube, your right ovaries, okay? Small, large intestine, your appendix, okay? And this word called ascending colon with the letter A. On the left side, you have these. Your left ureter, your left fallopian tube, your left ovary, okay? Your small, large intestine, and this word, descending colon. Now, we covered all the quads, okay? Just like it's in your book, okay? When they give you test questions in the future, you need to know what are hollow, what are solid, okay? which I gave you before. What are these certain conditions? We'll get to those certain conditions later on when you do abdominal emergency. Okay? Right now, is there any question on this diagram that you need to know or you're not sure of? Remember, when I say ovaries and fallopian tubes, I'm not saying for the men. This is in general to do with men and women when I discuss all the quads. So I know you probably know that, but just making sure I clarify that. Devin, question? Okay.
I have a question.
Go ahead.
I
For
was
the
muted.
PS test, was it pancreas, spleen?
Pancreas, spleen, stomach, small and large intestine. Now, the digestive system, they talk about it from your mouth all the way down to your pancreas. Please highlight each one on page 228 and 229. Mouth, salivary glands, oropharynx, esophagus, stomach, pancreas, liver, bile duct, small intestine, large intestine, appendix, and rectum. Make your little flashcards, go over that. That's the easiest way to do that. Okay? If they ask you about the lymphatic system, this is what it consists of. Spleen, lymph nodes, lymph vessels, thymus gland. There goes your thymus gland. We spoke about that before, to do with your T cells and other components. That's the lymphatic system. Know that, and that's on the following page, on page 230. And then the endocrine system. These are test questions they always ask right here. This, I want you to think of the endocrine system, complex message control, to do with the endocrine glands, and think of anything to do with hormones, okay? Insulin produces what? Pancreas produces what? Insulin, glucagon. Okay, insulin is considered a hormone. You need to know that, okay? Make sure you understand that, because that's where I see a lot of test questions go on. Do you have other glands? Oh yeah, you have the thyroid glands. You have the pituitary gland. You have the parathyroid glands. Okay? You have the ovaries. You have the testes in males. Okay? The ovaries in the women. So you need to know this. Okay? Do you have epinephrine? Yes, you know that's in your adrenal gland, which adrenaline is. So the next slide I bring up, this one here, insulin, in the pancreas. Insulin is produced in the pancreas at the islets of Langerhans. Islets of Langerhans. It's going to be coming up soon. Here it goes. When you look at this, look at all the different types of hormones you have. Okay? Pituitary gland. Okay, right here. They also call this the master gland. They said that this pituitary gland controls mostly all the other glands. This is what you need to endocrine system. Where do I see a lot of test questions? Right here. That pancreas. Okay, the pancreas. Because of insulin, because of diabetics. That you better know. So these are the glands. Any questions on anything here to do with glands? No? Beautiful. Urinary. Okay, they're going to talk about the urinary system. Know that the urinary system controls the discharge of waste, waste materials, filtered blood by the kidneys. Okay, it controls fluid balance in the body. Okay, filters and eliminates waste and controls pH balance. That's to do with your urinary system. Page 232, bottom left-hand corner, and then 233, part of it, to do with ureters, urethra, and urinary bladder. And you'll see this. That's how it looks. And then it gets into the reproductive system to do with the genitalia. Okay. That you're going to learn more when you get to OBGYN and so forth. Read it, highlight it, and that's on page 233 and 234. I definitely want to get into other stuff. So any questions from me on this? Any questions from anybody here? Okay, I'm going to ask you some test questions. That's always in the end of these PowerPoint presentations. Okay. Put on the chat, what's the answer? I love doing this with the students because it helps them understand more or less, because the end of these PowerPoint presentation, it always has the rationale. What's the answer for this one? You could put it on the chat. Even if you're wrong. C, which of the following are found in the retroperitoneal space? That means towards the back, the flank area, right? That is C. So comes up, the kidneys lie in the retroperitoneal space, the space behind the abdominal cavity. The spleen, liver, and stomach are all located within the anterior true abdomen. Okay? Rationale gives, which is awesome. And then it gives you the rationale why the other ones are not the correct answer. So it's very important. If you have access to this on Schoology, you should look at all these PowerPoint presentations and then answer the questions at the end. What's number 2? I got 1D so far. What's number 2? Okay, I got another D. Anyone else? Take a guess, somebody. Even if you're wrong. Don't be shy. The answer is D. The cartilaginous type of sternum is called the xiphoid process. That's the one all the way inferior of that sternum. The xiphoid process projects from the lower part of the sternum. It is made of cartilage and relative to other parts of the sternum. Manubrium, top, where the angle of Louis is, and the soft to palpation. So it's manubrium, body, xiphoid process. What's number 3? I got a few B's. Okay, the answer is B. A person with bilateral femur fracture has fractures both of his or her femurs, both sides. Bilateral means both sides. The term bilateral refers to both sides of the body with reference to the midline. Therefore, bilateral femur fractures would indicate both femurs are fractured. Number 4. I got 1 C so far. Anyone else? Take a guess. Another C. Yeah. The answer is C. The most prominent landmark on the anterior surface of the neck is the thyroid cartilage. Now, Kelly, look at this, the rationale. The thyroid cartilage, commonly referred as the Adam apple, its most prominent landmark on the anterior front surface of the neck. The cricoid cartilage is located directly inferior to the below the thyroid cartilage, is a less prominent landmark. But mostly that, you know it as the Adam's apple, you mostly see it out more in men than in women.
Okay.
Okay, just want to make sure you understood that.
Okay.
Okay, number 5.
Oh.
I got a B so far. It is B. Give me the exact location in the pancreas where this insulin is produced. The name.
Islet something.
That's right, but you're right, Kenny. Here it goes. It is B. The pancreas is solid organ that produces both insulin and digestive juices. Insulin is produced in the islets of Langerhans, which are part of the pancreas. Okay, you need to know that for future for test questions, especially the state. Number 6. We went over this earlier. I got C's so far, right? How many C's I got here? I got 3 C's, which is correct.
Okay.
Tendons connect muscle to bone. BMT, bone, muscle, tendons. Remember? BBL, bone to bone, ligaments. Tendons connect muscle to bone. Ligaments connect bone to bone. BBL, right? BMT. Cartilage is a smooth connective tissue covering the ends of bones at mobile joints. Joints consist of ends of the bones and surrounding connecting supporting tissue. What is number 7? I got a few B's so far, right? And the answer is B. Normal resting adult heart rate is 60 to 100 beats per minute. The normal resting heart rate is from adult, for an adult is 60 to 100. Bradycardia exists when the adult heart rate is less than 60 beats per minute, and tachycardia exists when it's greater than 100. What's number 8? Heart questions. Take your time here. Read the words. I got 1 A so far. Another A. And the answer is A, right? The left atrium of the heart receives blank blood from the blank. The left atrium of the heart receives oxygenated blood from the lungs. A. The left atrium receives oxygenated blood from the lungs via the pulmonary veins, the only veins that are oxygenated. Remember, it's coming from the lungs. The right atrium receives deoxygenated blood from the body via the vena cava, which is both superior and inferior vena cava. Largest part of the brain is the what? Okay, a lot of you, or a few of you, went real quick with A, right? And it is A, the cerebrum, the largest part of the brain. The three major parts of the brain are the cerebrum, the brainstem, and the cerebellum. The largest part of the brain is the cerebellum, which is sometimes called the gray matter. The cerebellum, sometimes called the athlete's brain, is the smallest part of the brain. The brainstem is responsible for vital functions such as the heart rate, breathing, and blood pressure. The foramen magnum is the large opening at the base of the skull to which the spinal cord passes. So they may use the word the opening or the hole in the base of the skull and so forth. Number 10. I got a few C's. Which of the following statements about red blood cells is false? It's definitely C, because what fights infections?
White blood
White
cells.
blood cells.
White blood cells, known as leukocytes. Excellent, Isaiah and the rest of you. Yes, makes sense, right? Does the red blood cells carry iron? Do they carry oxygen? They give color to the blood? Yes, this was the incorrect answer. The hemoglobin molecules in red blood cells carry iron, give color to the blood, and carry oxygen. The white blood cell play a role in helping the body fight infection. Now, we have a lot to still go through, and I have to touch bases on certain things. So what I'm going to do to make it easier for you, I'm going to go to certain review, and then I'm going to touch bases on what I want to make sure you know, just in case they give it to you. Okay? So I'm going to stop the share here. That means you only should be able to see me, not the other screen. Am I correct?
Mhm.
Okay. I'm going to close this over here. Okay. According to my notes, you got to make sure that we went over this and you understand it. Do you understand the word perfusion, diffusion, respirations, and ventilations? Yes or no?
The first one I don't understand.
Which one?
The first one you said, refusion?
Diffusion. I want you to know it goes, oh, thank you very much. Oh, that's illegal.
I think
Is
she
that
said
what I
perfusion.
think? Oh, she surprised me. And she's going to clog up my arteries. What you want me to go to, cardiac arrest? No, I ain't going to eat it. I'm hungry. What I ate before didn't fill me up. I feel content. She bought me some Nathan's cheese fries.
Didn't buy it.
Yummy. You didn't buy it, but you made it. That's good enough for me.
Artery
Everything that
cloggers.
stops the heart. Yummy, yummy, yummy. Okay, but let's go back to you, Kelly. Perfusion means it goes, excuse me, the one you said, diffusion. It goes from a higher concentration to a lower. So we want you to think of when you exchange gases, the carbon dioxide and the oxygen, it has to go from a high concentration to a low concentration, and that takes place in the alveoli. So I want you to know that word diffusion. Think of higher concentration to lower. So if you see a test question on diffusion, you know it means higher to lower. Do you understand that now?
Yeah.
Okay. Do you understand ventilations and respirations?
Ventilation, I kind of thought of it as like when like you're ventilating something. So as like, I don't know, like you're sucking something in. So it's like kind of like the amount of air you're breathing, kind of like the tidal
You are
volume?
right to that point, but to make it easier, right now in your room, all of you, can we say that the ambient air there is 21%, and it goes from that environment to your lungs? The air in your room, the ambient air, or the environment to your lungs. That's the word they use as ventilations. Now, you are right about squeezing or putting air or a form of ventilations into the patient's lungs, but you have to know all the 5 devices they speak about most of the time. Technically, there's like 6 or 7, but we're going to go over the main ones again. If I say a person needs oxygen, and I say, okay, I'm going to use Lewis. Lewis says he can't breathe right. Give him some oxygen. You're going to start with a non-rebreather. That's the first one you're going to start with. Okay?
Right.
He says, I can't tolerate that. It bothered me. Give me something different. I'm going to give him a nasal cannula. That you're going to learn in airway with your instructors. But now, let's say he needs the physical portion that you need to take the air with the oxygen tank and so forth and ventilate him with the air to go to the lungs via these 3 devices: pocket face mask, the BVM, that bag you squeeze,
Yeah.
and the CPAP. Those are forms of ventilations. The reason why I keep that separate from the other ones is because depending what is up with the patient, what's going on with the patient. If I'm breathing normal between 12 and 20, but I told you I can't breathe right, what you're going to do? You're going to give me a non-rebreather or nasal cannula. Okay, that's what the instructors are going to teach you and they're going to lecture to you about when you get into airway and so forth. So I need you to know that, but you're on the right track. Just think of the word ventilations, the oxygen or the air in your room to the lungs. If you're ventilating the patient, think of the 3 devices I gave you. If you're thinking you're just giving air to a patient because they tell you I can't breathe, think of the other 2, which is the non-rebreather and the nasal cannula. They're going to teach you that in class. I'm letting you know this now because my notes state to me, they're going to give you a bunch of words and you need to know each one of these words, what it means.
Mm-hmm.
Right? So are we okay with perfusion?
Can you go over perfusion, please?
Okay, I want you to think of perfusion. Good, adequate perfusion. It goes all the way down from the tissues to the organs and tissues, right down to the cells. It gives it needs. It meets the cellular needs. So there's good oxygenated blood there and so forth. So think of it going down to the cellular level, okay? That's perfusion. So think of your blood cells down to the cells that need that good perfusion. If it's inadequate perfusion, aka hypoperfusion, known as shock, it's not doing that. Are we comfortable with those 2? Beautiful. Are we comfortable with stroke volume, heart rate, cardiac output? I want to make sure you know those.
Stroke volume, I'm a little lost on.
Okay? What is stroke volume? Can anyone who remember what stroke volume?
The amount of blood moves at 1 beat.
In 1 beat, right? The stroke volume, right? And then the heart rate is the heart rate that you go of how many times your heart beats, right? So you take stroke volume times heart rate, you get the cardiac output, the CO, the cardiac output. You have to have good cardiac output. When you have good cardiac output, that means everything's flowing throughout the body correctly, the way it should be. Okay? So remember, cardiac output equals that formula, which is SV times HR. Not bad. Okay, are we comfortable with trachea, right and left main bronchi? bronchioles, alveoli, pleura. Are we comfortable with all those words and what we're talking about? If I say alveoli, what's the first thing that comes to your mind?
Gas
Diffusion.
exchange.
Gas exchange, right? After the alveoli, what two gases?
Oxygen.
Oxygen,
and
carbon dioxide.
Excellent, people. Oxygen and carbon dioxide, right? So you need, watch this, Kelly, you need that good so-called diffusion in there. So you can have that high concentration to the lower concentration, the exchanges of gases in the alveoli. What word comes to mind when those two gases are taking place in the alveoli? The word respirations, not ventilations. Ventilations is in the air in the room to your lungs, in the environment to your lungs. You see how I'm separating the two?
Yes.
Okay, good. I need all of you to understand that. Are we comfortable with words like aorta, arteries, arterioles, capillaries, venues, veins, superior, inferior vena cava? Good?
Yeah.
Okay, if you're not, you say it. That's why I'm going over. We still
Yeah.
got time because I'm going over all my notes, what you need to know for this exam, more or
Right.
less. So I'm going over all my notes.
So the first one and the last one you said.
The aorta,
Yeah, that one.
okay, the aorta is the largest artery of the body. Then it goes to arteries, then arterioles, because it keeps on getting smaller and smaller. So watch it again. Aorta, arteries, arteries to arterioles, arterioles into capillaries, capillaries to venues, venues to veins, and veins to superior inferior vena cava.
Gotcha.
Flow of blood. I will send you other things to help you.
Oh yeah, you did mention that the flow of blood, the way it does. the motion.
Excellent, which is the figure 8. I'm going to try to send this all to you guys, okay? We went over pulmonary veins, pulmonary arteries, inferior and superior vena cava. You need to know the left side of the heart, the right side of the heart, deoxygenated and oxygenated. Is there anyone confused with the pulmonary artery, pulmonary veins, anything like that? No problem, Devin. You're welcome. I'll see you next Friday. Oh, he already left. No problem. Okay, you good. We went over that. Are you comfortable with coronary arteries?
No.
Okay, coronary arteries are the arteries that feed the heart itself.
Okay.
In other words, you ever see a person that sometimes will have a heart attack and they got the coronary arteries very blocked and they may have angina pectoris and they may need to do an angioplasty? Well, the coronary arteries are the artery that feeds the heart itself. It surrounds the heart and feeds it itself because the rest of the arteries are feeding the body. But the
Right.
coronary arteries take care of the heart itself. Okay, good. Are we comfortable with these words? Striated muscles, voluntary muscles. Okay, what's the other one I gave you? Skeletal muscle, cardiac muscle, smooth muscles. Are we comfortable with the word smooth muscles and what they consist of?
Gastrointestinal.
Say that again, Kenneth.
Gastrointestinal. That's the one with the smooth muscles. Right?
Gastrointestinal is one of them, yes.
Can you repeat the first one you said? I had it in my notes, but I lost my notes.
Voluntary muscles, skeletal muscles, and striated. Those three are all the same. Cardiac muscle, only to do with the heart. Smooth muscle, I want you to think of the gastrointestinal, like the intestines and so forth, large, small, and so forth. And then the urinary are all smooth muscle. And then the blood vessels are all smooth muscles. You must know this directly from your book. Beautiful. Are we comfortable with the words like tidal volume, respirations, ventilations, perfusion? Just want to make sure. As you notice, I'm repeating myself because my notes state what they want and make sure you know and understand. Are we comfortable? What is the main muscle that helps you with your breathing? The main one. It separates the thoracic cavity from the abdominal cavity. It's called a muscular dome.
Muscular dome. How do you,
Is that
like
diaphragm?
muscular and then dome as in
Dome, like D-O-M-E.
okay,
Muscular dome.
muscular dome.
Kenneth, you just said something?
Diaphragm, right?
The diaphragm.
Yeah.
The diaphragm separates the abdominal cavity from the thoracic cavity. You need to know, are there other muscles that help you breathe? The answer is yes, but the main one is the diaphragm. Can we say the intercostal muscles, accessory muscles, pectoral muscles, abdominal muscles all help you breathe? Yeah. But the main one is that diaphragm. Okay? Are we comfortable with all different like positions?
Supine.
What we said earlier, we spoke about lateral, frontal, corona, anterior, posterior, proximal, distal. Yes? Frontal plane, transverse plane, anatomical position. You need to know these things. Okay. Can you tell me, in the blood, what is the protein that helps carry oxygen? You use a little tool to check this out, that oxygen saturation in the blank. It's okay.
Wait, can you repeat it again?
What protein?
Protein. What protein?
It's
Yes, what protein helps you carry the oxygen in your red blood cells? Hemoglobin is correct.
I didn't
Hemoglobin.
hear protein at first when
I wouldn't-
when
I
you
wouldn't
repeated
say-
protein.
Pronounce that.
When I say protein, automatically you got it, right?
Yeah.
So you need to know that. So I want you to think of protein, that hemoglobin. Remember, that's the one that carries the red blood cells.
Yeah.
You need iron. You need iron in your body because that helps with the transportation of the hemoglobin in the red blood cells. If you don't have sufficient iron, they say sometimes when they check your blood, you're anemic.
Yeah.
Ever heard of that? 'Cause
Yeah.
you need iron. There you go. Excellent. What two circulations that I told you are located in the right and left ventricle? There's two circulation. One goes towards the lung, one goes towards the body. I gave you two different names when we started the heart. I said, know these two circulations. One starts with an S and one starts with a P.
Systemic and something else.
Systemic and pulmonary.
Yeah, pulmonary circulation and systemic. Excellent. Okay, make sure you know that and understand that. This part of the brain controls the vital functions of life. You're pointing right to it, Kenneth. You were
Brainstem.
like that.
Yeah,
You're
I
right
was
there.
trying to give
You're
everyone
pointing right to it. Say it. The brainstem. This part controls your coordination, your balance. Which one?
Which one?
Cerebellum. Remember? Cerebellum, cerebalance, right? Coordination, balance. Which one is the largest part of the brain?
The shortest.
Also called the gray
Cerebrum.
matter. Cerebrum. It controls everything else, cognitive thinking, and think of that. All right,
That's
so
how
that's
I
how
remember it.
separate them.
Cerebrum versus cerebellum. Cerebrum,
Yes.
small word, is the largest part. It's the opposite.
There you go. But if you do it like I said it before, and I say cerebellum, cerebalance, get it?
Yeah.
You know it's coordination and balance. Then cerebrum, you just go right to that on that. Okay, not bad. If there are any questions on the right atrium, left atrium, right ventricle, left ventricle, septum, tricuspid, bicuspid, pulmonary valve, aortic valve, any questions to do with the heart, you need to know these words.
Trust.
Tricuspid?
That one.
Okay, it's very easy. Watch this. Remember I said you have the top chambers and the lower chambers?
Yeah.
Top chambers you need to know is your atrium, and the lower ones are your ventricles. You need to know on both right and left side, those atriums, when they go down to the ventricles, but on the right side is the tricuspid valve, and on the left side is the bicuspid valve. These are both called tricuspid or bicuspid, and they are called atrioventricular valves. Why? They go from the top to the bottom. Atrioventricular, atrioventricular, tri, bi. Get it? You got to try before you buy. Tricuspid, bicuspid. If they ask you what are the semilunar valves, the other two valves, which are like half moons, semilunar, is the pulmonary valve and the aortic valve. That's how you need to know that. If you have to remember, when one valve is open, the other valve is closed. So the right side of the heart can fill up and the left side of the heart can fill up. So if my tricuspid is open and it's going from the right atrium down to the right ventricle, if that tricuspid is open, that pulmonary valve has to be closed so that right ventricle can fill up. And the same is the opposite on the left side. If the bicuspid is open, the aortic valve is closed, so the left side of the heart can fill up. Okay? You need to know the valves and everything else. If I give you words like tachy, what does that mean? Tachy. Tachycardia. What did that mean?
Sticky, like stuck together.
No, not that kind of tacky. Tachycardia. Tachycardia. Anybody? Fast. Okay? Rapid. Fast heart rate. Tachycardia. Bradycardia. What does that mean? Slow. Excellent. Bradycardia. If I say the patient's in hypoperfusion, what does the word hypo mean? It's a prefix. What does that mean?
Paper.
Hypo. Hypo. What does hypo mean?
Low.
Low. Right? Low, slow. What does hyper mean? Hyper. That's high or fast. So if we give you words like the person is in hypovolemia or hypovolemic shock, that means to do with fluid or blood loss. If I give you the person is hypoglycemic, low blood sugar, you have to take the first word with the other word. So the prefix with the main word that put together and know the meaning. That's under medical terminology. That's chapter 5. Okay, but it's always words that they give you in other chapters. Are we comfortable with prone, supine, lateral, medial, midline, distal, proximal, superior, inferior? Any questions on that? Beautiful. Are we comfortable with the word left lateral recumbent?
No.
Okay, left lateral recumbent is a position you put your patient who
Recovery position.
you don't want, right, a recovery position. Excellent. Also known as the recovery position.
Like if they were having like, I don't know, like a asthma attack, you would want to like elevate them a little bit, right?
No. I see where you're going with that. No.
Okay.
See Nuki going to his left side? If I'm like this to my left side, on my left side, lying on my side, it's called left lateral recumbent or the recovery position, aka coma position. You put me in that position, to monitor me and watch for any vomitus, aspiration, or anything like that. That is the best side for patients when they are female who's pregnant in her third trimester or an overdose patient on drugs, okay, like heroin or methadone. It's left bladder recumbent. If you put them supine, they can aspirate. If you put a pregnant woman on her third trimester supine, you are going to cause supine hypotensive syndrome. So you're trying to prevent that. What supine hypotensive syndrome means that the baby in the uterus is compressing the inferior vena cava and it's lowering everything, their blood pressure and everything. So these are words you need to know for the future, but I'm making sure you understand them now because you may see them on exams. Okay. We have to go through this because we didn't get to go through it and it's part on my notes. When I'm going to pick up a patient, what is my posture? Okay, say it. I'm picking up a patient. I'm standing up. What am I?
Standing straight.
Standing straight, right? Now, can I say I'm vertical, straight up?
No, not all the way. Oh, yeah, but yeah.
Go ahead. Kelly, even if you're wrong, just say it. If you're not sure,
No, I was going to say, you just get like in squat position to
pick up the patient. Now, you see the way you have your hands?
Yeah,
Where it's supposed to be, that way or this way?
this way.
What is
Power
this
position.
I forgot.
Power something.
grip. That's right.
What was it called?
Power grip. So your
Power
hands are
grip,
closer to
okay.
the body. I'm going to grab the stretcher or the longboard with the power grip. And you're right. I am going to squat in a certain position. But you notice my posture is always straight and vertical. Make
Right.
sense? And this is
Yeah.
my power grip. When you lift up a patient, you lift with your extremities, your lower extremities and your upper extremities. Never with your back. You'll hurt your back.
Yeah.
Okay? So make sure that. The other question they give you to do with that, how much weight can you and I pick up? The average is 100 and what?
25.
125 pounds, which equal to 250. So you and I together could pick up at least 250.
Mhm.
In the book, it talks about certain way you pick up a patient, right? And how many pounds they could be. If you and I have a 400-pound patient,
Barry unit.
does it take 2 EMTs or 4 EMTs?
4.
There you go. Always test
Breeze.
question class in the state. If I'm going to carry a patient, there's different devices, right? There's the stair chair, there's the longboard, aka backboard, there's the stretcher, right? Call for firefighters, kind of is right. When you say that, you're like me, work smart, not hard. I'm not killing myself. I call for backup, you know? But right, no, when you pick up a patient, 400 more, 350, get 4 MTs. You 2 plus 2 more, or the firefighters, right? That's fine. The test questions we give here is also to do with carrying a patient. They give you different ways to do it. No problem, Isaiah. I'll see you next Friday, okay? I will send this to you. Did you guys, before you leave, were you able to get on the WhatsApp so I could transfer everything over?
Can it be a regular cell phone?
You could put it, ask Kenneth. He's the one who created it for
With
us.
Who
what?
made the WhatsApp?
I did. Just literally DM me your numbers. I'll send you the link. You could create a WhatsApp, and it's literally just a group chat, basically.
Because I already have WhatsApp. That's why.
Yeah, just DM me your WhatsApp, DM me your number, whatever. I'll add you to it.
Please, guys, get there because once this uploads, I'm sending this to you.
Okay.
Okay, you definitely want. There it goes. Alejandro just put it. Kelly, make sure you put it if you did it, and I'll send it to everyone. Let's continue here. You know you need to call for backup if the patient's too heavy and so forth. You know the power grip. You know the different devices. There's the stair chair, longboard, and there's the scoop and the stretcher. You need to know these devices. You need to know when you carry a patient, there's different types of carrying. There's the extremity carry, okay, that you carry them by the underneath the underarms, each arm, and they're behind the knees, called the extremity carry. One of the ones they always love to give in a state in class is called the diamond carry. The diamond carry with that long board, you have one in the front, one behind, and one on each side. If they ask you to state of class, this one you normally use when you're taking the patient from their bed to your stretcher. If they're sleeping on a blanket or on a sheet, it's called the draw sheet method. Make sure you know that, okay? So I want you to know and understand these in case they give you test questions in the future to do that. So you have to go back to this section of your lifting and moving. They may ask you questions on how you carry a patient, how you log roll a patient, how you, what device you may use. Go back to that. According to my notes, I'm touching base on everything we were supposed to do. The only thing I haven't touched on was, I think one of you, Kenneth or Lewis, you guys said they probably going to give administrative stuff. Yes? Okay. Administrative stuff will be, what is your normal GPA you must do and have in class? What is the normal GPA you should have?
I think it was 85 minimum.
No, 75.
Shit.
70.
Yeah.
To pass, yeah.
I'm a higher achiever.
75 or better, right?
Yeah.
How many absences are you allowed to miss for the class? And you still have to make it up.
0, but 2.
They changed it to 2?
I think so. I believe you
Okay.
can pick up only 2 classes. But they said, no, don't miss any. at
Right.
all.
Okay, if you see 2, then I think it's 2. Double check with them on when you see them, because my notes say 4.
Also, it may be 4. Because they say they can
Yeah.
make it up with you if we're absent. We can make it up with you on Sundays.
Okay, Louis, is that correct? I see your face.
Maybe because we're in the Tuesday, Wednesday, or the Tuesday, Thursday, so our Tuesdays are 2 classes in one because we go from 9 to 5.
Yeah.
That's why they say up to maybe 4, because each session is an absent,
Yeah.
AM and PM. Yes, you're right on that. So be careful with that, okay?
Mhm.
I have a
How many
question.
lateness would
they-
equal up 1 absent? How many latenesses?
2.
Yep.
I was going to say
Know
3.
that. This is according to the administrative stuff they went over with you guys, okay? So I want to make sure you know that.
So, according to the actual student manual, it says 2 full. You're allowed 5. No, you're not allowed 5. You're allowed 4. But if you get 5, you're gonna get kicked out of the program.
Okay, so the student manual says 4 absences, right?
That's it.
4 sessions,
Mhm.
afternoon and morning. That's 2 sessions right there. So technically, you don't want to miss 2 whole days. That's
Yeah.
crazy. But if you break it down in sessions, it's still 4. That's what I'm trying to say. Okay, so we're all on the
Yeah.
same page.
Wait, I have a question. They said, I'm not quite sure though. You have to go into Sundays. What if you can't make it on a weekend, like physically?
I'm telling you this right now, Alejandra.
Yeah.
Try to find coverage if you're working or doing something and make these classes, especially if it's skills. You know how difficult it is to make up this?
Yeah.
So if you got to miss work. Do it ahead of time.
Okay.
Because if you want to pass this class and get your money's worth, how much money you guys are paying for this program?
1300.
1,300.
My God, I know other places charging you $1,500, $1,600. So that's not too bad, $1,300.
Right.
When I first started with EMS, I paid $100-something.
All the good old days.
Yeah, that was the good old days.
Wow.
People say, how much, Nuki? So you guys could do this, trust me. I bought my first house with my wife, but especially me working hard in 1995 on an EMT salary.
Just the EMT salary?
I worked so much, the wife said, you keep on doing this, we won't see each other, we're going to get divorced. So that made me change everything around and say, okay, you know what? Let me change things around. But yes, you can.
There's not a lot of Sunday classes, by the way.
No. So, Alejandra, try to make it. I'm telling you, as a senior instructor that's been doing this a long time, try not to miss those Sundays.
The first one is on the 25th of this month,
26th.
right? 26.
26. All right, gotta write down the calendar.
I gotta write it down.
It's
So,
actually really
got a
important.
class there,
CPR schedule.
And then you're going to see me at nighttime, right?
Yeah, we could get on the same day, right? Like if we have the mandatory Sunday, and then we could tutor with you after, right?
Yeah, you'll see me. Even if you're a few minutes late because you got to take the train or the car from Laguardia, whatever, 6 o'clock is fine. You know, if you're a few minutes late, I'm not going to stop you from coming in. Okay? Make sure you're here. You want to do these reviews.
Can we
So-
actually attend all these reviews? Because in class we were.
Okay, hold
told-
on. Because that's always asked, and I want to do something.
Recording
Okay,
stopped.
now I could put back the recording.
For the last
Please.
10 minutes of class.
Recording in progress.
Okay, we're almost done here, so I want to make sure I hit everything on the notes. We did some lifting and moving. We did some other wording. We did everything on respiratory, cardiac, neurological. We did administrative stuff. Yeah, we did. We touched base on everything that I needed to go over. Next week, we would go over for the second exam. If you don't do well here, don't freak out, please. You got to think up to 13 different exams, a midterm and a final. If you can continue passing all these exams, God bless you. If you fail one, try to focus yourself again to pass the next one. Maintain a GPA of a 75 or better. Is there anyone here who need any questions answered? I know, Kelly, you need me to try to send you that PDF file. I'm going to do that. I'm going to try to email it to you. Do you have my email?
You put it in earlier in the chat.
Okay, I'm going to do it again.
Yeah.
Okay, because if I can help email any one of you stuff also, where's the chat here?
Jim,
Mute
I already put it.
participants. The chat disappeared on me. Here it goes. Okay. Oh, someone did it real quick for me. Kenneth, you should have told me you did it that quick. I'm over here typing like a donkey. Look at that. He already had it up for me with the name and everything. Thank you. I don't know how you did it that quick. Did you copy and paste? No wonder. Okay. Get in contact with me that way. Email me, and I'll try to send you certain things like that if I have not yet been able to put it on the WhatsApp.
I got you.
Kenneth for making it. Louis, Alejandra, Kelly, or Kenneth. Do you have any questions for Nuki?
Oh, okay, thank you.
Okay, you're very welcome. I'll see you next Sunday. Good luck on your first exam, and thank you for giving me this opportunity.
All right. Thank you.
Yeah.
Bye-bye.
Night.
One-
Peeps, hundreds across the boards, right?
Hey, listen, you could try for it, you know? Listen, I never got 100 on an exam, not even on the state, and I'm an instructor. I get a 90-something all the time. I'm like, the hell, what did I get wrong? So don't worry about it. Okay, I'll talk to you guys later. Take care.
Adios, senoritas, senors.
I'm the last one out, so if you log out. If you need to speak to me, I'll stay until you're done.